All right, y'all. Welcome to All Politics Local, America's number one political hip hop
Number
radio
one.
show. Y'all know if it's Friday, y'all know it's time for All Politics are Local. But more importantly, y'all know if it is the first Friday, it is time for our beloved brother, the one and only Congressman Donald M. Payne Jr. from our beloved city and our beloved district here in Newark, New Jersey. We're going to get into everything going on down in Washington, D.C., of course. But more importantly, we're going to talk to one of the perhaps most important and exciting brothers that I've talked to, thanks to the congressman, around amputations, but particularly around cardiology. So, real excited to have this brother back on. So we're going to talk to him first, along with the congressman on the Payne report. So we're going to talk to him first, and then Zaid, you're going to talk about what's coming up after that, my brother.
Yes, I have a wonderful author. Some months ago, we had my niece Crystal Charlie on, who's a doula, who talks about the challenge of African American women in their maternal health and giving birth, and how problematic that is, to put it mildly. We have another great writer named Linda J. Holmes, who comes to us recommended by the great Willa Cofield, who has an incredible book out called Safe in a Midwife's Hands, that really lays out the cultural legacy of our birthing traditions, and how, in spite of how our ancestors gave that tradition to the world, our people here in this country have the least access to something that comes directly from our ancestors. It's a great story. We're looking forward to that. After that, young man from Our Revolution, Matt Dragon, has lifted up a powerful essay challenging the question of the line in New Jersey state elections. So we want to have some conversations about, can we further democratize elections in New Jersey? And then we don't have DJ Rhino this evening, but there's plenty to talk about in the land of what's happening on the modern side of the contemporary side and the news making side of what's going on in the land of hip hop in its 50th year. So we got a loaded show. We ready to ride.
And of course, I understand John said that there might be a young brother, a young hip hop artist in the same vein as D1 that might be joining us tonight in that hip hop segment. So so we'll stay tuned, and once I get the text, I'll announce his name. But in the meantime, of course, you all know that it is the Payne report, and y'all see our beloved congressman is on board right now. So let's go on and bring him in.
All right. Well, good afternoon. Good evening, my brothers. How are you?
We good, brother. How you doing?
Good.
All right. Well, that first of the month comes around quick, boy. Turn around and it's like, where you at Friday? Oh yeah,
the anniversary. Let us remember the anniversary of the pivotal moment with one Rosa Parks refused to give up that seat on that same bus line in Alabama that would ultimately set off the most historic boycott in our people's modern history, December 1st, 1955. So we got to drop some ancestral energy in here. This is a heavy conversation.
As a matter of fact, my colleague from Detroit, who represents that district, went to the floor today to honor her on this anniversary. So, we're keeping the tradition alive and making sure, our young folks know, how they're able to do the things they can do because of people that came before them. So that's important. So, I'm delighted to have a young brother with me who is been doing incredible work over the last decade in the space of amputations. And, he's a doctor that performs them, but he decided to go the other way. He is dedicated his career to saving legs, to saving limbs. And so, I guess when it becomes necessary, he does it. But before that, this brother does everything he can to save people's limbs, and it's people that look like us that are more prevalent to end up in that position. The opportunities to save your limbs aren't as well known in our community as it is in the majority population. But this brother is doing everything he can to amplify that message and do all he can to save limbs. And he's the one that brought me to this. Peripheral artery disease is what it's called. PAD is a chronic, life-threatening condition involving the buildup of plaque inside the arteries of patients' lower extremities that often results in amputations. And this, more than 400 amputations occur each day in the United States. 21 million Americans are affected by this disease, PAD, with an additional 200 million others worldwide. So it's a really serious thing. And I came to it because the problems I've had with diabetes and getting ulcers on my feet that potentially could lead to amputations is where I kind of got excited or interested in it because of my physical condition. And so about 5 years ago, this brother comes on Capitol Hill with one of his patients, and doctors were all over Capitol Hill, and he came to see me. And he brought Miss Campbell with him, and she had her leg amputated. And the talk I had with her just made me want to do something about it. Miss Campbell has gone on to her reward, but I never forget that day in my office when I met her and this brother. This is Dr. Faluso Fakorede, who now hails from Mississippi. Came over to this country from Nigeria at a young age. Was educated in New Jersey. Went to Rutgers, and when he left his education, he's just been so committed. I mean, that's the thing that really I appreciate about him so much. You know how we talk about keeping it real? This brother keeps it real, because when he got out of school, he went to Camden. I don't know if that was the first stop, but he knew the need in Camden was the most severe in the state. That's where he went. And after spending a little time there, he goes, you know what? If I'm really going to be about this, I need to go to the epicenter, and picked up and moved to Cleveland, Mississippi, where now he plies his trade. And so with that, let me introduce the quintessential, the authority. He's saving people's lives, brothers. He's saving people's lives. Dr. Faluso Fakorede.
Hello, everybody. Good evening. Can you all hear me?
Yeah, peace,
Yes,
my
sir.
brother.
Welcome back, son.
Welcome
Welcome.
back, brother. Welcome
Privilege
back.
and honor to be here with y'all this evening again. Just honored to be in the presence of my friend and mentor, and our servant leader, Congressman Payne Jr. Blessed to have met him years ago, where now he's using his pulpit to help us decrease the rates of preventable amputations in this country. And it's an epidemic that's preventable. We talk about a lot of epidemics, COVID, and before COVID there were other epidemics in this country like the flu. But what people don't understand is that this amputation epidemic has killed more people than actually most cancers and most flu and other COVID epidemics. Every 30 seconds in this world, we lose a patient's limb due to PAD and diabetes every 30 seconds. And if you're just a diabetic, that's every 3 minutes. And unfortunately, once you lose your leg or your limb, 80% of them will die within 5 years. So it's a preventable death sentence where people are just dying. And we're seeing this rate 3 to 4 times higher in the African American population. So the question is why? Why are they chopping off our legs at a disproportionate higher rate than our other counterparts? And that's what prompted me to kind of investigate this further and look at the underlying reasons and some of the solutions. And I've been proud to work with the Congressman's office and other stakeholders on this issue for years now.
Go ahead.
Well, I think that for me, and I said this last time you were here, Doc, that I wish I had known you. When my father, was struggling with that decision about having his leg amputated when he was in the hospital. And I can remember, being 21 years old and going to see him. And, the doctors had told him that, if he didn't have his leg amputated, then, he would most certainly die. They didn't talk to him about, whether it was preventable, whether there was, some other medication, or whether there was some other doctor. And he most certainly didn't know anything about Black cardiologists, right? So he absolutely knew none of that. So, what is going on? I know you in Mississippi. What is going on, perhaps nationally, with all these different organizations to try and get you and get your message out to those folks? Because as you know, what happens with a lot of doctors, particularly a lot of cardiologists, they recommend their friends, right?
Yep.
So
it's a good old network,
right? You know what I mean? And so and then particularly if there's somebody that look like you, right, who is revolutionizing, saving people's lives, and saying, because what I remember you saying last time was that they are willing to pay for the amputation, right, to have your leg taken from you, but they're not willing to have it saved, which is absolutely incredible. And thank God for the Congressman. So what since you've been here, what's going on in terms of being able to make that louder, and what is going on at this particular point to try and help people get to you?
Sure. So let me just give a recap for our first-time listeners who might not have been privy to that previous conversation. When you have peripheral arterial disease, and it's kind of a fancy word for poor circulation in your legs, all right? It's the same process that happens in your heart and when you have a heart attack, and the neck when you have a stroke. You basically build up plaque and what I call goo in your arteries, and that clogs up your arteries, all right? And the progression, and means the rate in which you progress to having clogged up arteries, that is accelerated by some of the risk factors, some that are modifiable or non-modifiable. So what do I mean by non-modifiable? Every 10 years, every decade of our lives, we build up plaque. If you are your sex, in terms of females or males, females will lose estrogen after menopause, and then that increases their rates of plaque buildup. Sometimes in terms of color, we found out that minorities, but it's not a genetic code. There's a reason why, and some of the reasons are diabetes. Some of the modifiable reasons: diabetes speeds up plaque buildup by 3 to 4 times. High blood pressure, very prevalent in the Black community, speeds up plaque buildup. Obesity speeds up plaque buildup. When you have high cholesterol, when you nicotine use, when you smoke, you dip, you chew, all these risk factors. And then if you've ever had a family history, that itself too, it plays a role. So what happens when you have a clogged up pipe in your house is you call a plumber, right, to come in and do the roto-rooter thing or pour Drano. Well, the analogy in our field is that when you have poor circulation, you have to try medicines, and these medicines have to be affordable to patients, and then you have to try them on programs where they need to be encouraged to seek out services that are available where they live, where if they have a wound or ulcer, they can heal it. But before all that, you got to unclog that pipe so that blood flow can go in. Blood needs to go into the tissue so that it can heal. And if you don't give it time to heal, then we have a problem. And that problem becomes this black foot that we call gangrene. Well, what we're seeing in our communities is that when patients develop non-healing wounds and ulcers, the first thing they're offered is not all these preventative strategies that I've mentioned, taking care of their sugar, taking care of their blood pressure, telling them to quit, giving them time to heal, giving them access to doctors like myself who can do these procedures. Rather, what they're being offered is an amputation first strategy. Cut off the toe, cut off the foot. It's like a plumber coming in and saying, you know what, demolish the house if your kitchen sink is clogged up. And that's not fair. And so what we've done over the past couple of years is to seek out why are we not upstream doing preventative screening services. And that's where the Congressman and his office and other leaders are helping us craft, policy measures whereby we can say, hey, listen, those who are high risk of getting peripheral arterial disease or an amputation need to be screened early on based on certain risk factors. And those risk factors are if you're over the age of 50 with history of diabetes or nicotine use, or if you've had a family history of pre-AD, if you've smoked, if you've had clogged up pipes in your neck or in your heart, and if you have, renal disease, kidney disease, end-stage renal disease, those are risk factors. Also, the thing we have to do is it has to be affordable because, you have to understand, social determinants, meaning some of the factors that play a role, economics play a role, educational status plays a role. So are we educating the public in terms of awareness about what this disease is, that it affects 20 million people? African Americans, it affects us at 2 to 3 times a higher rate. The fact that, we actually are least likely to get all those preventative screening medicines and tools needed to save this, we're not. So we need to meet these patients where they are and go out to the community to educate them that if anyone offers you an amputation, seek a second opinion, because these hospitals don't play fair. So what we're doing with policies to help shape some of the language where we can raise awareness, give them access to preventative screenings, especially those who are at risk, and then try and offer some kind of pilot program that shows how you decrease amputations, just as we've done here in the Delta by decreasing amputation rates by 88% over a 4-year period. And that's by making sure that someone like myself comes here and sees the people as my family members. There's a high concordance of Black patients here in the Delta based on the history. Anyone who knows the civil rights history knows that, 80% of the patients here are Black. But Mississippi historically has had the lowest number of physicians per capita. So that's why I moved down here, so that these patients can see hope, that they can see someone who can offer them a preventative strategy rather than an amputation first strategy. And so the Congressman's office and other offices and other societies like the Heart Association, both the Cardiology and Association of Black Cardiology and Society of Vascular Surgery and other societies are working together with the Congressman's office and other offices to offer these policies and bring them to light. And that's what we're working on over the past 4 to 5 years. And we've seen traction like no other. We've raised awareness like no other. And there are a lot of people who are watching some of the documentaries of our patients telling their stories and saying, well, you know what, that happened to my dad, my brother, my sister. Let me call this guy and see if there's someone around me that can do what you do. So that's what we've been doing over the last 4 years.
So, and how do we, all that you said is great and terrific, but you said one of the most important things is screening and screening early, right?
Sure.
At what age should, particularly in our community, right? Because as you know, Doc, what happens with, and particularly with brothers, what I'm going to tell you is true. We're the last to go to the doctors, no matter. I mean, our toe need to literally be hanging off our foot for us to go, right? Yeah. So screening, how early should we go? That's one. And then two, like you said, the economics. How do we make it so that, or are there programs that can be created so that those screening costs can be paid for?
Yeah, so let me answer the latter. In the policy that we're advocating, it's called the Amputation Reduction and Compassion Act, which is a bill that's introduced at no cost sharing to the patients, predominantly those who are Medicare, Medicaid, and that's predominantly those who are minorities. Actually, if you look at the numbers, you will be screened for peripheral arterial disease once you have those risk factors at no cost sharing to them. So that's a plus if it passes. So we ain't trying to, because you have to understand 7 out of 10 people, Black people in the Delta, carry a medical bill. That pertains to everybody else. We're getting sicker, and so we're carrying a lot of medical bills.
Right.
And so we need to address that piece, and that's what we've offered at no cost sharing to them, at no cost to the patient. The earlier piece is very important. Let me tell you why, because this disease is flaky and it's funny and it acts like cancer. It's deadlier than cancer, but it acts like cancer. Half of the patients who have peripheral arterial disease have no symptoms. So it's like, hey, how do I screen for cancer? Well, it's based on your risk factors, right? That's how it works. Right. So, and two, if you know that something is slow, it's progressive, it's deadly, they need to be screened early on in the process. So what needs to happen is, if you know that you have the sugar, or you got diabetes, or you got the pressure, high blood pressure, or you have a family history of someone getting amputated, you need to go to your doctor, especially if you're over the age of 50, take off your socks and tell them to check your pulse and screen you for poor circulation. It's as simple as that. Or if you smoke, right? You got to go to your doctor and say, hey, listen, I heard this doctor talking about poor circulation. I need y'all to check me for a very simple test. Now, why isn't this performed by your primary care doctors every single time you see them, based on other preventative screenings you might have, like prostate screening, colon cancer screening? Why is that not performed for PAD? Because the body that actually regulates screening, U.S. Preventative Service Task Force is the name of this body that was founded by Congress, has failed to initiate preventative screenings for PAD. Because once they give it an endorsement, y'all, what happens is Medicare and other commercial insurance will stamp it that, hey, listen, if you have this disease, based on what the U.S. Preventative Service Task Force has said, y'all go ahead and pay for them. Once a year, or maybe once in the lifetime of that patient, they can be screened. But they have failed to do this for 15 years now. Because you know why? Because they're looking for data to back up screening. Well, we have a lot of data on amputations in Black patients. We have data that shows by congressional district that where I'm just calling from right now has a 200% rate of amputations versus the national average of 60%. We have data that says that Newark, New Jersey is the #1 congressional district of amputations in the state of New Jersey. We have data that even within a 6-mile radius of every top hospital, check this one out, the 6-mile radius of all the top academic hospitals, University of Pennsylvania, you go to New York, where a lot of minorities live. Anyone who knows Philly, right? You know, West Philly, where you can go get your Jamaican beef patty. Yeah. Right. UPenn is right there, where every top specialist in the world works. That is the highest amputation rates in that area. So to your point about trust, how many doctors at Penn are leaving their, what I call their academic, gowns in their hallways, or leaving their mahogany rows and going into the community to preach this story?
Right.
Not a lot.
Right.
That is the fundamental problem in medicine. We're not taught how to do this well in medical school. I submit to you, if I did not come from Africa and then New Jersey, where I saw things in not only New Brunswick, where I saw a lot of the Hispanic population go through stuff, and the Black population around there, and then going to Camden. And I was blessed to train in the Upper East Side of New York at New York Presbyterian Hospital, Cornell, one of the wealthiest zip codes in the world. I saw disparities. I knew what wealth and what the have-nots got. So that gave me the insight to say, you know what, come to the poor state where a lot of your people are and try and give them hope, but also deliver quality care, and then publish it to the world of what you did. And that's what we did for 6 years. I mean, this is hard work every day, going to churches, civic organizations, fraternities, talking to women, right? Because women are the key. You talk to women, then they go home and talk to the men like, hey, listen, this guy, he's cool. Go see him, talk to him, 10 minutes, and then you capture them. Because then it facilitates trust-seeking behavior. So we need a lot of people who look like me in medicine. And that's why I still talk to medical students, high school students. I go to places where there are a lot of people who can see what they can be. And then two is to make sure that the messaging and what we're trying to accomplish actually meets and exacts the message that needs to bridge the gap in disparities that has plagued this space for decades. So that's what we've been doing, and the congressman has been at the forefront of giving us all the tools we need from a policy standpoint, because policy founded the USPSTF, the U.S. Preventive Service Task Force. Policy is how we make stuff happen to basically, eliminate health injustices in the healthcare, and that's what we need, and that's what we're doing.
So Doc, you're being very kind, talking about the women and them going home and say, hey, you need to. They come home and say, you better take your ass to the doctor. That's what they say. You ain't gonna be walking around here without no foot and can't work. You better take your ass to the doctor.
Because what happens is they get out of work.
That's what they say.
Because think about it. Look at the workforce. Let's talk about how this affects economics. The workforce. Right. We're talking about, oh yeah, we want to see Black folks work. Well, if you're chopping off our legs, how are you going to see us working? Matter of fact, 80% of them will die after 5 years. So, think about how this cycle goes, and then what happens to that community that doesn't have a huge workforce? Jobs are not coming in. Then what happens to the tax bracket and the economics, then educational bracket? How many people are building jobs in schools? How do the schools improving there? Not a lot. So what does that happen to the generation of students who are in those communities? A lot of them are not coming out with high college educations. So you talk about, and then food deserts. Let's bring in all the food deserts in, all the bad stuff. Right. Let's sell it to them. It's affordable. It's cheap. Y'all can afford this. Then the sugar rates start going high. Diabetes starts getting worse. High blood pressure starts getting worse. Obesity starts getting worse. Then they wonder why we get sicker. Cancer getting worse. Fetal maternal health. People are dying even before they get their kids to this world. And then all this just becomes a perpetual cycle. The system is designed to get the results it gets, y'all. That's basically what it is.
Yeah. So Ed, the bill is HR 4281, the Amputation Reduction and Compassion Act.
Yeah, I was coming
to address the impact of PAD and prevent amputations. I introduced my legislation in June. The ARC Act would require Medicare and Medicaid to cover preventative screenings for high-risk individuals, establish a PAD education program at the Department of Health and Human Services, and require HHS Secretary to consult with organizations to establish standards for PAD screenings, and then require the development of quality metrics among payers and facilities that can prevent amputations. And so, it would also help develop a voluntary pilot program to support non-traumatic low limb major amputation prevention through the patient risk modification and management in early screening and detection, surveillance, testing, and treatment for PAD. So, more than 50 of my colleagues have signed on. We're still working on it.
Yeah.
We're still working on it because, like the doctor says, it impacts everybody. Everybody knows someone. Oh, my uncle or my aunt, my cousin, Right. And it's an epidemic. It's a plague, really, on our community, and it impacts the larger population as well. But you know how we say, when they sneeze, we get a cold. So
they sneeze, we get pneumonia.
Yeah. So Congressman, to your point too, one last thing I feel to mention is that people who know about heart attacks and strokes, when you have PAD, peripheral arterial disease, you have a 6 times higher chance of having a heart attack or stroke because of that process is occurring up here. So I think what's happening is we need to flip the script. We're thinking people just having heart attacks and strokes just, off the jump, that's just randomly happening. It could be possible, given that the prevalence of PAD is higher than stroke, that maybe it's because they haven't had their PAD checked. And that is manifesting as a stroke, manifesting as a heart attack. But we will never find out if no one is checking their pulses or doing the studies, the simple $100 studies it takes to rule out circulation in your legs. If you don't do those, then let's keep on paying. You know how many billions of dollars? That's a $20 billion bill. It costs our healthcare system to take care of all these patients. That's 75% of that is paid for all of us who pays taxes. So this is our problem, and this is our dollars, and it's our people who are affected.
Yep.
So, Doc, let me just ask this, and you can. So, Doc, so you're saying a good age for our community to start that test would be at 50.
Yes, sir. 50 and over if you've had, if you've had the following risk factor, meaning if you've had these conditions, medical conditions, if you've had diabetes, if you've had high blood pressure, if you've had exposure to nicotine, like, people always say smoking, but remember down south here, people dip and chew when they smoke. So I just use nicotine use, like nicotine exposure, nicotine products. And then also, if you've ever had any kind of plaque buildup in your heart, or if you had any stroke, you need to get screened in your legs, because that could have been the culprit. And then also, if you've had kidney disease, especially renal insufficiency, what we call end-stage renal disease, you need to get screened. And lastly, if you've had a family member who's had this, you need to get screened. Those are the risk factors for PAD.
And I got them all.
Yeah, I just got that last year.
So we should ask for this test when we go see our doctor. Ask for the PAD test.
PAD screening test, yes, sir.
The PD or PAD?
PAD, peripheral arterial disease. PAD, yeah.
Screening.
Yeah.
Okay,
yeah.
Great. Because I can't recall, I can't recall my doctor even saying that, right? Saying, let me test you for a PAD. And me and the Congressman and Zaid were in the same age group. And
Can I answer that? Let me tell you why. This is why I love having sessions like this, because what y'all are doing is monumental in terms of educating your community, and they're blessed to have y'all have this platform. Majority of doctors in this country are not taught well about PAD in medical school or their training. I repeat, majority of doctors, including me, we only had 3 questions in 4 years of medical school on this topic. 3 questions. So here's the question. The problem is, it's not just, so you know what we're doing? We're catching up. So we're waiting till we become these big time shot doctors, and we're trying to figure out, who knows about PAD? Now let's go back and try and fix the curriculum that is being taught to thousands of future doctors. So that is why this message also has to be taken to the medical schools. And what are y'all going to do to change and impact your curriculum so that there will be more awareness from the medical community itself? That there's lack of awareness on the patient side, community side, and the providers. So what I believe is, you inform to transform patients. Patients, let's bypass the middleman, man. Like, you know what? We're bypassing the middleman. Let's go straight to direct to consumer approach. And that's what I love about this. It's, let's teach you what the problem is, and then y'all go and teach your doctor, or you demand from your doctor what needs to be done. That's ownership.
Well, you listen. You just opened me up, brother, and because I tell you, I can, and I'm telling you, I just had a visit, a blood test, and all that with my doctor, and I can't remember that conversation where we talked about a PAD test, right? We talked about every other test, but I'm not hearing that test, right? And thank God for Congressman Payne, and thank God for you, right? That you brothers are even talking about something this important.
Yeah,
right?
every year, 200,000 legs are chopped off every year due to PAD, and 150,000 of those are diabetics.
Wow.
Now, predominantly Black legs.
Wow.
So, it's Black legs, then Hispanics, then Native Americans, and their Caucasian counterparts in that order. So the question becomes, how come we are not hearing a public outcome? It's one thing to hit here, but how come this isn't on every major network? Like, we have an epidemic that's been going on for decades that people are not addressing. We spend more time and more money chopping off the legs than saving them.
Right.
Even though we know that the odds of an amputation can be decreased by 90% based on everything that we have talked about in terms of screening and timely intervention and seeing the right person. But y'all know how hospitals work too. When you're sick in a hospital, they're not trying to front and give another hospital, business. Like,
Right.
hey, you know what? Let me transfer you to Dr. Fakorede at this different hospital. It ain't happening.
Right.
We do not have that shared collaborative effort that is being bred amongst hospital colleagues. It's always competition.
Right.
So how has that now even impacted the lack of sending the patient to an appropriate center that can treat this patient? And that's something that's a whole nother discussion as to how our hospitals and how our care centers operate, because it's costing people their lives.
But I wanted to ask,
No, I wanted to acknowledge Dashawn Farrar joining us in the conversation. Congressman, I wanted to ask you, it's good to hear that you have so many co-sponsors. What kind of opposition do you anticipate in connection with the bill? And what do we need to do to get it done?
I just think it's like the doctor says, it's just a matter of awareness. If you can imagine, Dr. Fakorede is trying to, educate the providers, the doctors, then, we got a long way to go and a lot of work to do. So, we just one or two at a time. I'm just like wearing them down. So I think that we're going to get to a good place. I've got some support on the Senate side as well. So we're optimistic. It's going to take. It might take me a little while to get it done, but I'm committed to the fight.
Let me contextualize the question, because I mean we're at a time where this country's at a crossroads between democracy and fascism, and folks who want to give away Social Security, want to get rid of medical insurance, who got some really crazy ideas about what should and should not be happening with government and taxpayer money. So I don't want folks to have any illusions about the movement of this bill, no matter how well intended it is, right? This is the land of medical apartheid, right?
I was going to mention that, that book.
Raising the antennas, so the community is alerted to our responsibility, our role in the quest to make this kind of thing happen, because it's important to make happen. And it's the kind of thing that, unfortunately, as young doctors telling us, often falls under the radar. Right? If it's under the radar in the doctor's conversation, it's under the radar in our community conversation.
Yeah, that's a great point. Because where I'm speaking from is about 20 miles from where Emmett Till was killed, and where his memorial sits. And when you go back and you mentioned medical apartheid, I mean, it's what has happened here is that systemic racism in healthcare is clear and ever present. All right, and let's not get it twisted. Racism exists in healthcare. It's systemic. It leads to the waste of resources, and early deaths in certain communities, particularly those of color. And the goal is to eventually dismantle it. But without policy to back us up, it's not going to happen. The way I compare this epidemic, when lynchings were occurring, I mean, this was instantaneous. People gathered in a freaking square, and they watched people die immediately. Well, here, what you're seeing is, we're not going to do that because, their policies now, it took them decades, but it just passed, which is shocking, not too far back. But now we're saying, let's chop off their limbs.
Right.
You know why? Because the same outcome is going to happen.
Mm-hmm. Mm-hmm.
5 years from now, that person is going to be dead. Where is that outrage? So the outrage is, is this happening in Black communities more than white communities? Yes. Is it happening in some white communities? It is. Actually, if you look at the congressional districts, very poor, anyone with a poor socioeconomic status, you're also impacted by this epidemic, because poverty sees no color when it comes to, the impact of you having food deserts or food insecurities. and lack of access to quality medical care. I mean, 50% of the hospitals in rural Mississippi are about to shut down, both in black and white neighborhoods. 50% in both black and white neighborhoods. So you can have all the hope that, hey, listen, even if I catch this disease and I get screened, who am I going to go to? Whether we rank number 1 or 2 in diabetes, but we only got 15 diabetes specialists in the whole state, endocrinologists. Y'all know what endocrinologists, diabetes specialists? We only have 15 in the whole entire state. Where I trained in New York, in Upper East Side, New York, we had 15 on one campus in Upper East Side. Why does that disparity happen in a state that has 40% African American population and they carry the highest burden of diabetes? Why is that statistic? Why don't we have 150 in 2 districts that are predominantly African American? Why? So here's some of the questions that we ask both the Department of Health locally, and we have national, representation in terms of, hey, what's going on and how do we address this? Because it's not just here. This happens everywhere else. What affects one affects all. Mm-hmm. So that's just facts, and we need to do better.
Mm-hmm. 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 Absolutely. Yeah. So we're on a mission, and I couldn't think of a better partner to have than Dr. Fakorede. He's been absolutely incredible, and it's like we're kind of like Johnny Appleseed. We just keep planting the seed and meeting more doctors and members of Congress and people to bring them into our cause and our mission, and we're going to be successful. We don't have a choice. There's no other option. So we've got to stay at it, and I'm committed to that fight.
I wanted to ask the doctor, with this information, and you're actually an example of what we in the New Black Panther Party used to say, that whatever field you're involved in, if you're Black, be revolutionary in it. Actually, to quote Brother Bashir Akinyele, I have to ask you, dear brother, do you find yourself being targeted for the information that you're presenting? I have to know that.
Of course. I mean, it's the Congressman knows. But
man.
But that said, when your belief is so strong and your passion is where it is, and the vision is what it is, and that it's a higher power beyond you that's leading you on the mission, you can't pivot, and you can't be, I tell people it's like a horse race, like a jockey on a horse. If I turn around and look around, that could be the end. If I'm looking at my back all the time, no. So, I am as fearless on this as possible. I don't fear anyone. I'm speaking truth to power. I'm being a megaphone for my people, and until that mission is complete and every voice is heard, and I've unturned every stone, and I've knocked on every wall, and I've had every advocate and every entertainer or sporting person come and learn about this, then I still get on the horse every day, and I run my race. Mm-hmm. So that's what I do. I run my race until the man upstairs says your race is done.
Yeah, because right now, as I'm listening to you, you bring to mind, our brother from CMOTAP, Dr. McIntosh, but also our brother from the Nation of Islam, Dr. Ali Muhammad. The way you're, the information you're bringing, that you put me in that mindset.
Well, and the doc won't mention it, but I know some of the history and trial and tribulations he's gone through. The organized Mississippi medical establishment has tried to put him out of business on several occasions. Wow. Accusing him of illegality and other things and malpractice and all. And he's just stayed the course. He hasn't let them deter him, as he said. I know it's some rough times and all, but he's kept his head up, and has kept marching forward, and it's really been to the benefit of this country, actually. So yeah, he's had some tough times, in doing this, because everybody doesn't necessarily want to see him be successful.
Mm-hmm.
So
that's why I raised the question about the depth and the character of opposition to the bill. And Dashawn, I appreciate your question and lifting up our comrade Bashir Akanyele. And I'll go a step further. The Black Panther Party has 62 community survival programs, including medical clinics, community-based medical clinics. I had tagged a good friend of ours who's also been on the show, who's been our go-to person for COVID and what that has done to our community, Dr. Chris Purnell. We need to have some conversations about really developing this conversation in a community-based way.
Mm-hmm.
We really do more of that. I'm always looking at, and as I raise the questions, I raise the question is in the context of a community voice and community taking responsibility for what it is that we must do to help move the needles. We're talking about, from a human rights lens, these are our preventable deaths, excess deaths, right? And when you're talking about excess deaths taking place and without the kind of systematic support to prevent that or to keep that from happening, then we need to be talking about something else. We're talking about violation of our human rights in a very real way, and what does this mean for the kind of genocidal battle that we've always had to contend with in this country? That's still continual or residual, dimensions of the medical apartheid that I was alluding to earlier. So that's you're on the one, and we got to really look at how we can move this further.
But I think that a couple of things. One is that it would seem to me that that because it involves so much money, right? We understand, based on what the brother just said, with a brother who obviously cares about his people and want to prevent them from losing their limbs, when these folks are making a financial calculation, not necessarily a political calculation like the congressman is, but they're saying what he just said. So if you cut someone's leg off and then in 5 years they're going to be dead, why even bother, right? So if you're making that kind of calculation, as opposed to giving this brother an opportunity not only to save your leg but to save your life,
that's right.
Mm-hmm.
He becomes a threat in and of itself, right? So it would behoove us as a community to make sure that we find a way to get this brother to the world, but also at the same time find a way to protect him and the congressman. Because remember, the congressman being on Front Street is just as much at risk for being able to bring this up and try and get this bill passed too, right? Now we know Brother Payne ain't ever been scared. We know that. But at the also clear, right? That congressman ain't traveling back and forth to DC with no security, right? So we got to keep all of that in mind as we move this forward, because it would seem to me that this because I'm just thinking about my own self. I mean, because this is going to be a question I'm going to ask my doctor. Well, doctor, how come you never brought up PAD test to me?
Mm-hmm.
And we talk, and Dr. Fakorede, we talking about somebody who's been my doctor for over almost 40 years.
Wow.
I'm not surprised.
Right.
I've told you why.
My brother.
Not surprised. Although
Yeah,
shocked.
but Ed, don't look at it as a potential situation of neglect. Remember, the doc said that they don't get the training about it. They're not taught. They're not taught to look for that. So, don't hold it against him. Thinking he's just neglecting you. But it's a matter of what the doctors say, what they're taught.
But
they don't know what they don't know. And some of them.
But would that be, Doc? Let me ask this question. So, but you know how when they do your numbers, right? When they say, "Oh, you borderline this, you borderline that." So, but Congressman, I'm asking. So that would not have come up though. Like if
Yeah.
somebody said
Yeah, it's not blood work. In blood work, you're looking at your numbers for okay, how's your sugar, how's your kidney function, how's your liver function, how's your cell count, your bone marrow working okay, and then you're looking at how's your cholesterol, right? So that's what you do blood work. In this condition, PAD, what you need to do is you need to first of all take off their socks and check their pulses because it's like one pipe that comes from your heart, which is where your heart beats, all the way down. It goes up to your neck. I can check your pulses up here. You can check it in your arms. You can check it, below your belly, and then in your legs, in your feet, the top of your feet. You can check someone's pulses. When you see that the pulse is diminished, it's not pulsing as strong, that means somewhere in that pipe, all the way back to the heart, there might be something clogged up based on your risk factor that I mentioned before. And how you test that further is to do where they take a blood pressure cuff and they measure your blood pressure up here and down in your foot, and they take a ratio. And if that ratio is less than 1 significantly, we call that an ankle brachial index. Ankle, foot, brachial, heart. The index ratio. Ankle brachial index, we call ABI is the ratio. If you do an ABI and that ratio is abnormal, then that means there's something clogged up in that space, in that pipe. And it needs to be worked up by a vascular specialist, someone who knows what the heck they're talking about. Mm-hmm. What happens usually is, one, people are not told to take off their socks. I mean, if y'all have been to a doctor where they said take off your socks, no, zero. Right. I mean, it doesn't happen anymore. So that is the first. That's why I mean that go to your doctor and ask him to check your pulse for your circulation. The second piece is if he says, well, there's something wrong with your circulation, or you've had diabetes for a while, or your parent had poor circulation, or you've had a heart attack, stroke, or you've had kidney issues, then tell him that, hey, listen, I need you to do further testing to make sure I don't have poor circulation in my legs, just as you would do a stress test to make sure I don't have poor circulation in my heart. That is the same analogy. So that is basically what needs to be done. And if the doctor is not going to do it, then seek a second opinion and find someone. This is another thing we need to highlight. In our community, we always say yes sir, yes ma'am, and fail to seek second opinions.
Yeah, that's right.
Right.
I always tell people Southern hospitality is out the door when it comes to your health.
Yeah.
You need to find someone else, and that's where we come into play.
And that's so true, Doc, because in our community, the doctor is the end all beat all. The doctor says something to you, you don't question it. He's a doctor. And you might need to ask somebody else.
That's it.
Yeah. So the doctors are the ones who are saying, go chop off your leg. That's the first way to treat this thing. I call BS on that. That's not correct. That is not the first line of treatment for this condition. Unfortunately, 75% of patients who have this poor circulation are offered a first amputation strategy nationally. Here in the Delta, that ratio is 90%. 90% are offered a first amputation strategy. That's why our numbers are number one in the country. It just makes so the question becomes out of the all the congressional districts by ranking amputation rates, Mississippi has its 4 congressional districts are top 5. 4. So there's a reason for that, and so we need to do better. We need to do better. I think we can do better. It takes disruptive mindsets, meaning doctors should not just go to society meetings like they're little, and I hate to say this, we all talk to each other a lot. Like we'll go to all these society meetings and, cardiologists talking to cardiologists. It's like corny. No, I need to talk to like women who read Reader's Digest, men who read, Ebony Mag, like women and men who read Ebony Magazine or who watch BET. Or people who watch different mediums, or just people who watch your channels, your show today. Because I cannot keep on speaking to medical professionals. That's another side. But you need to go straight to the consumer.
Yeah.
So that they can relate, just as you have, Mr. Riley, like, hey, listen, I wish I met you. My dad had this.
Yeah.
That triggers, then you know what? We need to end that generational scar, because just as they apply the blade to him, they might want to apply the blade to you if you had that condition.
Yeah.
So how do we end that generational scar? That's the fight. And that's where I need voices and I need ideas from people such as all y'all here that, hey, listen, maybe we need to target this person or these people and or these organizations, because that's where we amplify the messaging, and we continue to amplify like wildfire.
Hey, Ed, watch this. Doc,
Yeah.
tell them how much you've reduced the amputations in that area.
Yeah, 88% in 4 years.
That's huge.
Yeah, 88%.
That's huge.
Yes, sir.
That's huge.
We're very proud of that.
This should be reverberating around the country.
Wow.
Man, that's why I make them say it. Shoot,
Right on.
man, are you kidding? 88%.
But you know what? I'll be honest.
Reduction.
As y'all know, it's not easy to move from up north to the middle of nowhere, in the Delta to do this. So as much as it's something that I committed, and I've spent 9.5 years now here. I went to high school in Teaneck. I went to Rutgers University. I could go to the Starbucks, and walk up and here I can't do that. I gotta drive 2 hours to do that.
Right.
I can't go to the airport. I gotta drive 2 hours. So you got to have this mindset. The mindset has to be different to go to a rural, underserved community. Mm-hmm. There are a lot of underserved communities. We talk about Doctors Without Borders, where people go to all these international countries. There are a lot of places, even within metropolitan areas, where people like myself who are leaving their trainings can go and immerse yourself, and have a purpose-driven mission, purpose over profit, because money will come eventually if you do well in medicine.
Right.
You ain't gonna go broke doing the right things.
Right.
You're gonna go broke if you're paying lawsuits because you're doing a lot of illegal things, right. or karma is gonna catch up to you at some point. But if you do the right things, people will come, and so that has been kind of the mindset, and that has led to exposure. Because if I wasn't here, I would never have met, my brother, the Congressman Payne. I would never be on this show. I keep on telling people I owe it to the state coming here to have this national platform. So in medicine encompasses the power in mankind to do good, to heal, to be humanistic, but you got to have compassion and care. I see every patient as a family member. If you don't have that lens, then you're not going to be able to have that impact. So that's my message to those who are in healthcare who are listening today.
So can I ask you a question, Doc, as we get ready to run out of time on the Payne report? Is this a conversation that the Association of Black Cardiologists, are they picking up on it?
Yeah. So I am the PAD initiative chair for the Association of Black Cardiology nationally. So I run the show. So we are, I use that pulpit. That's how I'm here on the show today, using my pulpit to say, hey, listen, I'm going to talk at different mediums. And we've spoken to, our story has been published in different mediums, ProPublica, NBC Nightly News, CBS, and Walgreens just did a piece on our patient that was published yesterday. But, we still need more awareness. Have y'all watched all the NFL games, NBA games, MLB games? What do you see? Cancer awareness, right? You see that?
Right.
Let me give you a statistic. PAD kills more people than most all cancers combined. PAD kills more people. So do you know what we need? We need a PAD awareness campaign on that scale. So what did it take for the Susan G. Komen and all these people that came up with the PAD with cancer awareness? Well, that's what we need for PAD. I always tell people you need a big time awareness campaign. You need celebrities. You need sport guys. You need the sport athletes. People to be talking about this. It's not just up here. It's levels to this. And so until we get there, I think the societies just have to keep on working collaboratively, and people like myself just have to be disruptive in terms of how we choose the mediums to send out the campaign messaging and who the messenger is. That matters. You can't have no straight old guy in a white coat with the glasses talking about PAD is this and this and just bore out your audience. Like, no, you have to be able to speak to them and meet them where they are, where you keep it real. Like, that's what you have to do.
I think you're right. And that's how you get to that 88% you got, right?
Yes,
because
and so
it comes down to that keeping it real, like the Congressman said. That is so important.
Yeah. The technical competence too matters. You got to be skilled, but the interpersonal competence also matters, because that's how you get in the process, especially in my community, the Black men. That interpersonal competence matters.
Yeah.
So Ed, he's open. He's his practice is gotten so prolific that he's had to open another facility down there. So you have two now, right?
Yes, sir. Yes, sir.
He has two, and Ed, he also, you know, it gives back to the community. Well, I mean, in his medicine, he's giving back
a lot.
Always, but I mean, he is philanthropic in his practice as well. He, you know, some of the devices that he used have a date stamp on them, so they go obsolete. So what he does is he partners with the companies that give him these facilities, and they just donate it to him, and then he does procedures free.
If you're uninsured, yeah, we take care of that. We don't ask about your insurance. Your insurance status doesn't matter, and that's the beauty of owning your practice. And when you go to hospitals, they ask you for copays. I actually watched it happen here, where a patient did not have a $65 copay, and they told her that you're going to amputate your leg. And I met her in the back door, and I said, no, that's not going to happen, and we took care of her. And that day, I said, I have to have my own center because this is not right. And so, you know, it's not only that, but, you know, being a community member and being respected in the community by your peers, not only the commissioners, but the mayors and the sheriff's office, just because I actually engage them and we teach them and we support their events, that we tell them to come support ours. My other clinic is in Clarksdale, Mississippi. Clarksdale is you know, nationally, you know, people know there's a lot of hip hop artists from Clarksdale, Rick Ross being one of them. But Clarksdale has one of the poorest populations in the country, and so what we do is we give back, and we have events there every month, trying to have something with the community, just to educate them, and then the kids, the county colleges, trying to give back to them and help them develop scholarships for people who want to be nurses or doctors.
That's my man. That's my man, Ed.
Yeah, he's
straight from Cleveland, Mississippi.
New Jersey, but you know, but hanging out in Cleveland, Mississippi, man. I'm a Jersey.
Yeah,
well, I'm calling Dr. Fakorede too, brother. I appreciate this, brother, man. I'm always excited when you ask him to come on, man. And you know, I'm sure I don't need to say this to you. I know that, you know, anytime, you know, you want to come on here, brother, with Dr., you know, with our beloved Congressman, but anytime, Doc, you want to come through, man, we'd love to have you and just help our people, man, because, you know, I think that, you know, clearly, man, that if we had that information, there'd be a lot more people like my dad who would have lived a lot more years than he did and going home to be with the Lord at 61 years old. So he was when he was here, man. So, you know, I just want to say thank you, you know, for coming on, and thank you, Congressman Payne, for bringing them back on, man.
Absolutely.
I'm honored. My pleasure. I'm honored to be in the midst of you know, of not only greatness, but people who are servant leaders, and people who just know their stuff. Because I can listen to y'all, and that, you know, we all have different backgrounds, but we have the same commonality in terms of our goal and our mission. And so having Congressman Payne Jr. Being a mentor to me is very important. You know, I'm a doctor, he's a congressman, but what he gives me is wisdom. And I tell people that's something that I can't put a price on.
Right.
And he helps me navigate the waters as someone who's learning how to deal with some of the forces, both positive and negative forces that might want to take you in or take you out.
That's all.
And for y'all too, you know, I just love the platform, and hopefully next time I'll be able to come on the hip hop segment and listen. I love that, you know, that's what I get.
Bob, since you mentioned that, Bob, as you go out, you got to tell us who you're listening to.
all day. I mean, you know, I think we had this conversation before, but, you know, I would say, you know, if you were to walk into my procedural suite where I do procedures, you know, anywhere from Jay-Z to Rick Ross to Nas to Biggie, like, that's playing a lot. You know, a lot of the new stuff, I don't, you know, I listen to Cole and Kendrick, but, you know, it's then we can go into other folks.
Y'all heard it.
This morning, my patient wanted was it Barry White? We listened to Barry White for about an hour, and then then we flipped it. We flipped it to we flipped it to LL Cool J.
So much to hear.
We put LL Cool J. So it all varies as to what the patients first get their first rights.
Right.
If they don't say anything, then we'll kick it in.
Right. Hey, Congressman, you ever tell them what you was listening to when you were running for office?
Oh, Jay-Z. Oh, yeah. Streets of Watson. Streets of Watson.
Oh, my God.
That's my anthem. That's my anthem.
Your anthem. Well, that's cool. I mean, if I were to pick one, I mean, Reasonable Doubt album would probably be more of my stuff.
Yeah.
That album was pivotal for him. But
well, Doc, it just spoke to me because I was I was running and, being the second generation in this town, people are kind of, dissing you and looking at you like, oh, just because it's your father, you run. And so, the song starts out as, if I shoot you, I'm brainless. You shoot me, you're famous. What's a nigga to do? And when I heard that, I said, oh my God, I am living this song. If you listen to that song, that was exactly everything I was going through right at that time.
Wow.
Congressman Donald Payne spitting lyrics.
The visual still on that track is dope. So yeah, absolutely.
Hey Doc, when we was in the studio, when he would come home, right, we'd play his theme music for him. You know what I mean? We'd have
That's good to know. That's good to know. That's good to know. You can't be wrong. I don't know if his museum is still, the Book of Hope is still on, but that's something I want to catch in Brooklyn. I heard they did a good job on that. For Jay-Z.
We got to get some stories.
I want to say thank you, man. We appreciate you for coming on the Payne Report and hanging out with us, man. We don't need to tell you, man, that, it's one love here, brother. So, we definitely got your back, man. Anything you need, brother, all you got to do is let the congressman know we riding with you.
Hey, you might have to have him on some other weeks.
If there are any cool events where some folks are showing up in New Jersey, hip hop heads, man, because I see the congressman hangs out with some hip hop heads. I'm like, whoa, where was I? I didn't get that.
He supplies the DJ for the congressional weekend.
No, my God.
Oh yeah, yeah.
Yeah, you got to go down there where he be doing the DJ battle, right?
That's gonna be dope.
Yeah,
good times.
Appreciate y'all. Y'all have a great weekend.
All right,
thank you,
Doc. Take care.
Yes, sir. I'll be in touch, sir.
All right, thank you. All right, brothers.
All right, man. Thanks a lot. It was I'm always elated every time you bring that brother on, man.
Yeah, he's the truth. He's the truth, man. There aren't a lot of brothers like him, man.
Yeah,
he's an incredible individual, and I respect him a lot.
Yeah, because you one of the things man, is that most of them cats, get in and they get that information, they become sellouts, making all the money they can. But what he just said is, he said the money's gonna come, right?
Right.
Because he's doing good, man, for our people.
Yeah, he's at that point now. He's doing all right. But I mean, it's his philanthropic side that really touches me. He does some of those procedures for free, man, saving people's limbs. Yeah. Like as long as he has the equipment he needs to do it, he just does it.
Yeah.
All right, brother.
We definitely got to keep building that bridge, Congressman. Thanks again.
Yes, sir.
For coming through to do the Payne Report, brother.
All right, and see you next month.
It'll be here before you know it.
See you next year.
That's right. Next year, Congressman. That's right.
Yeah.
2024, my brother.
It'll be good.
Yes, sir.
All right, man.
Peace. All right. Peace.
All right.
All right, my sister. Welcome to the show.
Good evening. How are you?
Good evening.
Linda, welcome.
Thank you.
Ed, let me tell you something. Let me try and set this segment up for you, dear Queen. Right? And I'm gonna layer it when I set it up. Do you know that this queen comes to us recommended expressly by the great Willa Cofield?
Wow.
All right.
Wow.
So I mean, that's before I did any background on her. I said, Ms. Willis said she need to come on the show. I said, well, just say when. I looked her up and made the outreach, and we finally made it happen. And I'm glad we finally making it happen. Linda Janet Holmes, author of an enormous book coming out, a book that was called the most anticipated feminist book of 2023. I said, whoa. And that's powerful to hear this great tradition that you are claiming or helping our community reclaim. And with what you shared, and there's so much I want to touch on in terms of your background is and whatnot. You've got a great story. There's an artist that you were inspired by that is an unsung hero that we should lift up. Hoping we have in this conversation. But first, tell us just very quickly about the book and what's going to happen with your book signing tomorrow.
Okay, so before I do that, I also want to lift up the name of Willa Cofield. As you said, I wouldn't be on the show if it weren't for that link and that connection. But I met Willa when I was a student at Rutgers Livingston Douglas College back in the late 60s. And we have remained in touch. I've been aware of her many projects. She's in the process of finishing up her book.
Yes.
And a real inspiration to me in terms of staying focused and believing in the work that we're doing. So Willa really has helped me to stay focused on not the me and the I of it, but on what is it that we think that we're doing that's going to benefit the entire Black community. And so I continue to be inspired by Willa in many ways. Now, you were asking me, what was that question that you had for me, first of all?
Your book signing tomorrow. The book is safe in the midwife hands. I didn't say the title of the book. Damn, let me clear my head out, right? Safe in the midwife's hands is going to be a book signing tomorrow in Plainfield. Now, I'm originally from Plainfield. That's the other thing that I latched on to because, I come from a wild little town that needs all the love and information they can get. So, but tell us about the book signing tomorrow, and then we'll take a dive on all that you're talking about and the incredible story of your own walk.
All right. So this is another, Willa connection. I'm from East Orange, so not too far from Plainfield. But Willa, when I told her about the book was coming out, and she was excited, and she said, "You've got to come to Plainfield," And I'm thinking, well, I don't really know anyone in Plainfield. But over the last several weeks, I've learned that Willa has countless connections in Plainfield and across the state of New Jersey, and of course through the work that she's done with the Black Women's History Project. But tomorrow, thanks to Willa and to Karen and some other folks in Plainfield, I will be there to talk about my book. I will be there with another midwife, Shirley White, who is from Plainfield and has worked many years at the Plainfield Health Center. I will be talking about how it is that I came to write this book. I will be talking about my work in Alabama, talking to traditional midwives, as well as the work that I did in Africa, in Nigeria, in Ghana, in Ethiopia, and really collecting stories from midwives. But the reason that I'm really motivated for this conversation tomorrow is because I want to talk about what I learned from these midwives, both midwives in the South and both midwives on the continent, and how their stories are relevant to some of the issues that we're facing now, some of the things that I think you were touching on with your previous person that was on the air about.
Glad you heard that. Mm-hmm.
Yeah, that this is not just history. We're not just looking at the past, but we're looking in this book. I'm looking at how do these stories relate to the crisis that we continue to face that's fueling the current birthing justice movement that's going on in the United States. And so tomorrow we expect to see women who are interested in their own childbirth experiences, families, folks who remember having had a midwife themselves, whether it was with a midwife here in New Jersey or going back, a couple of generations who might have even been born with a midwife, right?
Mm-hmm.
And so I see the I'm going to be talking a lot about my story. We're going to be hearing from a midwife about what midwives are doing now and today, facing the current crisis, and what can be gained from midwifery care in the current environment. And so we're just looking forward to not just reflecting on the work that I've done, but also hearing from people who are attending, women, men, elders, young people, what questions they might have about the past, and as well as looking at the present and looking towards the future.
Well, so let's get into it. Let's get into it a little bit now, and let's build off that previous conversation. we talked about some horrible disparities in terms of what our doctor was just talking about, right? Now, for all of its pretensions, you said now you I didn't realize that you're from East Orange, that you're Jerseyite, right? And for all of the facade about New Jersey being the Garden State and a blue state and all of those things, we got some serious problems with Black maternal mortality, don't we?
We do, and just to be fair, it's not just in New Jersey; it's across the country, and it's alarming. It's alarming. I previously worked at the New Jersey State Health Department, and I headed the Office of Minority and Multicultural Health for about 10 years, and that was so. I'm talking now 20 years ago, because I've been retired for 10 years from that position. But, even then, and actually, ever since we've been collecting statistics, right, about disparities, there has been a gap, right, in the care. But what has happened more recently is that in the past, folks thought about it as, well, maybe it's women who have lower income, maybe it's women who don't have access to prenatal care. Maybe it's because folks aren't eating right. But then a couple years ago, some stories were hitting the headlines about women who had access to quality care, women who were, well-to-do, like the famous tennis player, Serena. And that these women were facing, their lives were at risk, giving birth as a Black woman in this country. And so I think there's been an awakening in terms of just collecting more information about the problem, and trying to understand that it is that race has a lot to do with it, that racism has a lot to do with it, and that it doesn't matter what your income level is, what your profession is, that there are risks involved just because as a Black woman that you face in the process of giving birth. But my book really is to look not so much at the problem, but to look at what can we learn from Black women who, against incredible odds as midwives, managed, unlike what we're seeing now, to have positive outcomes in situations that were difficult, right? And so even in the era of enslavement, there were midwives who were able to have positive outcomes. So what is it, in my book, I'm looking at what is it can we learn from Black midwives in the United States? What can we learn from Black midwives on the continent that might help address this problem in New Jersey, in Plainfield, in East Orange, across the nation, to overcome, Black women being 3 times more likely to die in childbirth than a white woman.
Well, let's build on your own story, right? You are of the survivor of a challenged birth yourself, and from what I've learned, that's what set you off on your journey. Why don't you tell us about how that happened for you?
Yeah. So I've been asked a lot, how long did it take you to write this book? Well, a lot of things came in between, but my daughter was born in 1976. And in writing this book, it became very clear to me that was what planted the seeds for the book that has come out. My daughter is now like 48 or something, almost 50 years later, that spark was lit. was a single mom at the time. I was doing part-time work, working as like a secretary, temporary secretary at a hospital, at Beth Israel Hospital in Newark.
All places.
And Ghana's dad was unemployed, so I didn't have health insurance. And I gave birth at St. Joseph's Hospital in Patterson. But I was someone that came out of the Rutgers Douglass Livingston Black Student Movement. And Ghana's dad was very much involved with the Black Power movement. And so we weren't wearing those labels, right? we were like, you know, I have a right to choice in terms of the kind of birth that I have. I as a woman, feel that I can have decision-making power about, you know, the where and the place of birth. And it was the time when there was a lot of conversation going on, mostly among middle-class white women, about doctors feeling like they were in control of the birth experience, right? That the male doctor was going to come in and be in charge and say, okay, this is what you need to do, and I'm going to deliver your baby. And women started saying, no, wait a minute. There are times that, you know, we don't think that we need the medication that you're talking about to be overly drugged at the time of birth. We think that we should have some decisions about whether we want to breastfeed or not breastfeed. And just kind of this whole idea of women taking back their own power in the birthing experience, wanting to be awake and aware, wanting to not be directed by the doctor, right? And so I embraced those ideas, and lots of Black women were embracing those ideas at the time. But when I went into that hospital, I was not seen as a liberated, Black power involved Black woman. I was coming in their eyes, as an indigent woman, a woman who didn't own.
When they had no money, no insurance.
No money, no insurance, and not married.
A Black woman with no money, no insurance.
And it was a Catholic hospital. So they were shocked that I had what I would call my list of demands about what I wanted to happen in my own birth experience. This was like totally unexpected.
You must have some nerve.
Right? Yes. And it was
go ahead.
It was pretty funny because I'm remembering now, like the nurses, some of them who were nuns, and they finally, like I said, you know, I don't need pain medication for these labor pains. Like I want to walk, I want to do this. And then I became like a showpiece. Like they weren't supporting me. They would just say, we've got this crazy lady in here who thinks that, you know, she can make decisions about her birth, that she can be up and mobile. And, you know, she has this list of things that she wants to do. And she's not really listening to us about what we're saying, like stay in the bed and let us take your knockout drugs and all that. And so finally, and I'll be talking more about that tomorrow. So ultimately, when the time came to give birth, I said, I'm not going to push this baby out until you say, yes, her dad, my partner, can be in the delivery room with us. So this is 1978 or 1976. And they said, there's no way we're going to allow. And I said, well, then I'm not going to push the baby out. But we were really having these, like, you know, whatever. And so at the end of the day,
fighting for your medical self-determination.
Exactly. And that is what Black women are doing now. First fighting for our lives, right?
That's right.
Fighting for our babies' lives, and saying that doctors have not, they don't have the answer. If they had the answer, we wouldn't be looking at the
time
that we're looking at. So let me take a deep breath. You know what, when I about this stuff, I get worked up again. So
that's all right. And you should, because it's powerful stuff. But I want to bring you back, because you've been on this walk claiming and reclaiming these stories for some time. Your first book, Listen to Me Good, where you really sat down with an elder and really got it in with her, and then going back to the source. And I was personally touched by some incredible women in my life. I had a comrade who was a midwife legend in Harlem, Nkululeko. You know Monica Kolileko?
Yes, I do. Very,
She
very
was
much
a
so. A good
wonderful
friend.
comrade. We traveled to Cuba together many years ago, right?
Oh,
Amongst some other things. But she was, in that Lombe Numza Brass circle, my Pan African circle in Harlem. She was very much a center in that, and was a pioneer on that particular front. And we are forever grateful for her. So I just want to say up front that I appreciate the reach that you have taken in going back and taking this initiative to reclaim our stories. But now let's tell us about how you're doing that. Tell us about what you've been writing about. Tell us about these women you've talked to, and tell us about how is it that our ancestors who gave this tradition of the world, right, now see their descendants being boxed out of access to the very thing that is stabilizing births in industrial countries all over the world, except, of course, the United States, for white women.
yes.
Hip
Yes.
hop, we call it cultural appropriation.
Yes. Yes. Well, it's interesting because people will say to me, well, it's not just midwives in Africa. It's not just Black midwives who, believe in using alternative birthing positions, using herbs. But I have to remind folks that we are the beginning. So that all of it
And we have the
begins.
right to claim that.
Yes, and we have a right to claim, and they need to be reminded of that. So it's, we are continuing birthing practices that, Egypt, going back to the very, very beginning of time. And the wisdom of it, as you said, in Europe, where there are the birthing outcomes are much better than they are in the United States. And there have been lots of studies that show that midwives are the providers who are making the difference, right, in these positive outcomes. But doctors, up until very recently, have seen birthing as their marketplace, and therefore have set up all kinds of barriers to make certain that they remain in monetary control in terms of how the insurance, reimbursement works and all of that, so that the monopoly around birthing remains in doctors' hands. And in spite of the fact that we know that when you look at the statistics in terms of outcomes, particularly when you're looking at in Europe, where the majority of births are with midwives, and compare them to the outcomes in the United States, there's no question that midwives have better outcomes in most cases. I mean, there are situations, and I always need to add this, there are certainly situations where there are complications, and the benefits of modern science and technology, et cetera, have their place. But for the majority of women, a healthy birthing outcome, when they have the support and the care and the skills like the midwife that you were talking about, who have this enormous experience, which is a great link to Margaret Charles Smith, the first book that I wrote called Listen to Me Good. She's no longer living, but she attended more than 3,000 births in her in Greene County, Alabama, which is right on the border of Mississippi, to get back to your previous guest. And
The H. Rap Brown gave us the Greene County Black Panther Party sister organization of Kwame Toure's Lowndes County Black Panther Party. So I got to drop this movement stuff in there. You said you got some movement background. You home, my queen. All right. Go ahead. Go ahead. Carry on.
Yes, because so anyway, so she began practicing in the 1940s as a midwife, but her grandmother was born in Africa, right? And her mother died early. Her grandmother raised her, and she was not a midwife, but she was a herbologist, and she knew about the plants and could go out into the forest and knew what plant to use for what ailment or what tea to make. And so she passed that on.
Oh, I thought we lost you for a second.
I couldn't get it on my laptop, but Margaret Charles Smith learned from someone born on the continent about herbs and how to translate this, the forestry of Alabama and see the connection in the leaves and the plants and what to use what plants for, right?
Yeah, John Henry Clark said we did not come to this country or to the Western world culturally empty-handed.
Exactly. Another person in Alabama. So she attended more than, there are records that show she was recognized, to get back to your other program, she was recognized with the Congressional Black Caucus for her work before she died.
Wow.
She may have lost, according to the records, like maybe 5 infants out of the 3,000, like stillbirths or something like that. Wow. And never lost a mother.
Wow.
And this is when, if there was an emergency, this is in that book, if there was an emergency, the only hospital that would care for a Black woman, and this was, Lowndes, but she had to go to Tuskegee. So she's coming all the way from
Greene County. Oh my God.
Yes, and they would get the ambulances wouldn't take them, so they would get like people who were, a funeral home owner would use one of their, those the hearse to drive her, but it was rare that this happened. But that was, again, how the Black community worked together to, Tuskegee, the funeral home owner, the midwife, to succeed. But when I did my first book, I did it because Alabama passed a law eliminating all midwife practices. And the only list that was ever done that came out at that time, all of the midwives on the list, except for one, were Black women. The majority of folks born in the American South before 1950, the overwhelming majority were attended by Black midwives.
Yes, ma'am.
So it's a myth that Black midwives were the problem. And once we moved birth into the hospital, this was the argument that they were making. Once we move women into the hospital with white doctors, then we're going to have all these great outcomes. And meanwhile, we have this Margaret Charles Smith story. And I'm going to conclude with this. This is the kind of person she was. I went to visit her, and which I often would go back to talk to the midwives that I interviewed because they had such an impact. And I went to visit her, and we were working on the book together, and it really is her book. It was oral history recorded, and then I edited it, and then she had a 3rd grade education, formal education, but fireside learning and all the wisdom of the world and lots of experience. But I said to her one day, I said, "What would you like for me to do? Like, go to the grocery store, post?" She said, "I want you to write a book about me."
Wow.
And that's how that book was written. I tape recorded her interviews. I read the stories back to her. And, she's been recognized before she died, by the Congressional Black Caucus. But when I interviewed her in 1981, she was being put out of practice along with some 300, it was actually 150 midwives at that time. Just routinely, didn't matter how many babies you had attended. It didn't matter how successful you were. They were all told they could no longer practice. And their mothers had been midwives, their grandmothers had been midwives, and some of them could trace their midwifery back to Africa.
Wow.
Now, Miss Linda,
Go ahead,
in terms of safety, comparing to having a baby in a hospital or having a baby at home with a midwife, how is there a comparison when it comes to safety? Has that been measured?
That is a really, really excellent question. And I think it's very important for me to say, before I answer it more specifically, that when I talk about my work, and I call it the calling that I've had to bring these stories forward, it's not to say that every mother or every family should have a baby at home with a midwife, for example. There are definitely women who benefit from having medical interventions from doctors who are skilled and are free of some of the biases that we know exist. And some of this has to do with some of the ongoing issues that we face as a community in terms of environmental issues, right? In terms of access to, healthy foods. Um, there are women who are addicted to drugs, cigarettes, and all. So there are complications that can happen, and there are women who benefit from a skilled person, male or female, who are adept at providing that care. However, the problem has been even in those situations, there are clearly doctors who are biased and have um, inappropriately applied their medical skills or have not applied them with equity, right? They treat a white woman coming in one way and they treat a black woman coming in another way. And sometimes the problem is making sure that they have access to the medical interventions that would be relevant at that time. And repeat your question again, because I did want to make that point, because sometimes when I'm talking about this, the conclusion is, well, do you think that every mother should have their baby at home with a midwife? I think that there are lots of factors that come into making that decision about where it is for you as a woman or family.
If all things are equal, would you say it's safer for a mother to have their baby at home with a midwife or in the hospital? If all things were equal.
I would say that most of the midwives, I worked with midwives at the nurse midwives at the medical school in New Jersey. And one of the things that midwifery training talks about a lot is how do you assess a mother in terms of prenatal care, in terms of expecting the mother to have a healthy birthing experience. And most midwives are really very uh, skilled in that and have been trained and having that conversation about one example might be if you're expecting to have multiple like twins or triplets at the time of birth. And I talked to the midwives, and there were some of them who delivered more than one baby. But if the midwife, and I trust most midwives in this, are able to say, based on what we're looking at in terms of your health and your past experiences, that we can expect you to have a healthy outbirth, and that we have, if something unanticipated happens, we have the appropriate backup, that you will get the care that you may need in an emergency. That I think that if that is on the table and that's very clear, then I think that if that's what the mother wants and chooses, then absolutely it would be appropriate to have a birth at home with a midwife.
Let's build on that and back up a step, because Donna is asking a basic question that may require another step for the benefit of those who may not know what a doula or a midwife is and what kind of training they have. Why don't you share that too, because that'll further amplify her question and your answer.
Okay, so let me just say a couple of things here about the book signing tomorrow. Tomorrow, there will be a midwife there, right, who has had extensive experiences in attending childbirths, not just in various settings, across the country. And so when answering that question, I prefer for a midwife to answer it. But there are midwives, there are various ways of entering the field of midwifery. So there are midwives who become midwives through nurse midwife training programs. Some of them are based in medical schools, universities. Others have they're licensed midwives who have training in programs where they do not have to be a nurse first before becoming a midwife, but have a way of gaining the experiences and reaching the academic requirements and attending births prior to. And I think that one of the things that when you're thinking about a home birth and a midwife is to ask the midwife, because many different ways to becoming a midwife. The midwives that I interviewed, who had excellent outcomes, many of them became midwives through apprenticeships. They worked with a very skilled midwife, went out with that midwife, observed their practices. That midwife had good outcomes. And that's the reason that Margaret Charles Smith became such a skilled midwife, because she had a very extensive apprenticeship. And certainly on the continent, that was what I learned about the most, that midwives, sometimes as really young girls, would uh, be identified as someone who looked like they had the making to become a midwife. And so for years, they would follow a midwife before they actually began to practice independently as a midwife. A doula um, is the midwife is the person, the woman who actually is carrying and I would use the word delivering the baby or catching the baby at the time of birth, and that is her space. So doulas um, do not deliver the baby, catch the baby, but do what doulas do, and what is so critical and so important about doulas. Doulas um, develop, and so do midwives, develop relationships with the mother very early in the pregnancy, right? And they're not just concerned about the medical aspect. Many doulas will accompany a mother when she's going to see the doctor or the midwife. She will be concerned about, um, helping her with things like nutrition, or, maybe she needs to be in a yoga class. Is she getting enough exercise? Really looking at the whole person, not just in the during the time of the prenatal care visit, but visiting her at home. And midwives do that. Also, many midwives who do home births, but really looking at the whole person, not just seeing her as a birthing mother, but really, does she need help with childcare? And then doulas also are present, of course, at the time of birth, but very involved after the time of birth as well. And we are very excited because we know that there are going to be doulas at the um, at the library tomorrow, and we'll have material out, and people will have a chance to talk with doulas about their work, and let people know if they're interested in having a doula supporting them during the time of pregnancy and birth, as well as midwives in the area who can be very, very helpful. And I always like, and I'll say this now, and I'll say it tomorrow. I like to step back and talk about more about what I learned from the stories that I heard from midwives in Africa and in the United States. But when there is a midwife present, which there will be tomorrow, and there will be doulas present tomorrow, I always feel it's appropriate for the midwife to have an opportunity to be speaking with me about this. And that's why there's a midwife in conversation with me tomorrow.
Now, is it
Go
true
ahead.
in
Sorry.
Pennsylvania, uh, insurance will pay for a midwife or a doula, but we haven't reached that in New Jersey yet?
Let me just, did I say I live in Virginia? Did we say that yet?
No, you didn't. No, I didn't.
Okay.
That particular detail of.
Yes.
Once you said Jersey, we just grabbed that, at Park Avenue in East Orange right now.
Right.
This almost became Mayor Orange, right? So we claiming New Jersey stuff.
Right. I will not be able, I certainly can't speak to the laws in Pennsylvania at all. And that's
Okay.
a complicated thing because all the states have their own laws, and
Right.
yeah.
Well, I know that our Assemblywoman Senator-elect, she is fighting very hard for it to be law in New Jersey. So, I know she would be very excited about it.
You're talking about Senator-elect Brittany Timberlake.
Exactly. Yes.
So tell me more. What is she?
She is advocating that this will be a choice that a mother will have, and that will be payable through their insurance.
Yes, that's critical, right? That it's not something, and that's why for a long period of time, women who were middle class and could afford to have a home birth were more likely to have a home birth than others because insurance was not covering it. And that's a major barrier. That's very good news.
And you would be proud to know that this young woman who we're talking about is straight out of East Orange,
Oh,
right from the
Yes.
district.
That's right. That's right.
She
well,
went
are
into
you,
the assembly
will you,
just a few years ago, very courageously as a fresh person in the assembly, pushed through an independent prosecutor's bill that's supposed to help us on police brutality, and is a very somebody we're very proud of on the electoral front, in ways that that kind of character unfortunately has become exceptional as when once upon a time it was the rule. But that's some good hometown stuff. I thought we thought you would appreciate.
thank you so
There's so much I want to get into with you, because I mean your relationship with Tony K. Bambara. Tony was an incredible writer who's kind of fallen under the radar with the power that she brought. And you're in Virginia now. I was going to ask you what kind of support have you been getting in New Jersey, but since you're in Virginia, right, a crossroads state, right?
That's what it is. That's what it is.
Mildly, right? What kind of support? Where is the trend in terms of support? For this grand tradition. Uh, Now that you're there, what are you seeing,
well. I
and
think,
what do we need to see?
yeah. I mean, when my book came out, the first book, Listen to Me Good, we were kind of mourning the loss of midwives, because generations of midwives were no longer, the skills weren't being passed on, the practices weren't being passed on. And even in Alabama at that time, they eliminated, there was not, no, they, there wasn't eliminated, there was no nurse midwifery program at the University of Alabama. Um, and Virginia, similarly, all across the South, they eliminated the traditional Black midwives, indigenous midwives, um, and then there was this real gap where they had some white midwives who were practicing underground. Um, but it has been really incredible. It's almost like an overnight revolution that's happened across the country, not just in Virginia, that I'm aware of. Like, for example, doulas are now getting Medicaid coverage for their services. Midwives, midwives practicing in hospitals has been a problem. Increasing access to birth centers has been a problem. So I don't think I don't think there's a state yet that we could say is a model state. And maybe New Jersey may be one of the ones to cross that line first, but to really open the door to access, to choices, and where you have your baby, who supports you at the time of birth, and providing support through insurance, through Medicaid, for those services. And we still have a long way to go, even in terms of providing more opportunities for programs, educational programs for midwives. When I was at the medical school back in the 70s in New Jersey, there was only one midwifery training program. There's a lot happening in terms of changing laws across the country about, how do you become a midwife, um, respecting various roads to midwifery, which was some of the things that you had hit on earlier. So I'm optimistic. I mean, compared to 1981, when we were really thinking that this was the end. But one of my favorite stories was a midwife who I met, and I was telling her, this is really this is awful. This, what are we going to do? And blah, 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 blah. And she said, girl, she said, do you read the Bible? And I said, yeah, from time to time. And she said, they were trying to get rid of the midwives back in the Old Testament. Did they succeed?
Ms.
And
Holmes,
they're not, we may have some bumps in the road, but
Right.
going to survive.
Racism and
Ms. Holmes,
male sexism and patriarchy. Yes.
talking talk
Yeah.
about it, Brother Zahid. Miss Holmes, you being in Virginia, do you know, Sister, have you ever crossed paths with Sister Azanathari, Momototo village?
Oh
She's
yeah,
out of
yeah.
DC.
She's in DC. That's on. Yeah, yeah. But I'm in Hampton.
Okay.
I
Oh, yes, ma'am. Right. Right,
um.
you're at the southern end, but the reason why I have to mention that, of course, Zaid, Zaid, remember Sister Aza, she came
Mhm.
out of New Black Panther Party, but Aza started that several years ago. She, her and another sister from Philadelphia, Sister Asasia, very well, friends of ours
Mhm.
that we know, and of course, she's been featured. So, of course, she wasn't the first sister that I know to be involved with that, but you discussing an attempt to kind of like erase this. I'm glad that the torch is being passed
Mhm.
because I'm sure she's familiar with your work. I'm sure Ozzy, one of the people that in some way inspired her to do that, but she's been doing her thing for quite some time, at least a decade.
Yes, yes, yes. I gave a talk at George Washington University recently, and there were some folks from there who were doing work there. I don't think she was there at the time, but her work is groundbreaking. It's recognized just not nationally but internationally. There is this. I think we're in a pivotal moment right now, where it's become clear that like I said at the beginning of this, when I was at the health department, it was kind of like, well, these women, they just don't know how to take care of them. That kind of like, just, I don't even like to repeat that stuff, right? But now understanding, that the problems of systemic racism and that we, we're going to be waiting a long time for that to get fixed, right? So
Mm-hmm.
we have to return to that idea of the tradition of midwives. We've got to take this in our own hands, and that's similar to what you're talking about. The sister saying in DC, we are going to have to build, um, or as they say in church, this idea of make a way out
To
of the
heal
way.
as
We're
we
going to
speak.
make a way. Yes, yes.
Mhm. As we wind down, just two things very quickly. One, I apologize that I can't physically be there tomorrow, but I want you to know that in Newark we have a very highly regarded bookstore, and I'm going to see to it that they take your books, and we'll see if we can look into have them organizing a book signing for you too. All right, the bookstore is called Source of Knowledge, and it's very highly regarded.
Oh, you all been around for a while. Source of
Yeah, yeah,
knowledge.
yeah. That will be.
Knowledge.
Yes, it's well. If they ain't got your book, it's time they get it, right?
All
So
right.
I'll personally see to it that they fix that,
Thank
right?
you.
As we now, I didn't get a chance to tell you and all of this, from our Miss Willa Connect on down. I didn't get a chance to tell you that this is a hip hop talk radio show. So we have a ritual question that we ask all of our guests. Donna, you want to do the honor and ask?
If you were
Question?
about hip hop music, I don't think I'm going to have an answer.
Yes.
Do
Whatever
I
you
want to ask the question? I sure do. So, Miss Linda, when you're
Yeah.
out and about doing your work, whether it's teaching, um, ministering to a sister and preparing her for possibly having her child doing the midwife and a midwife. Um, what are some of the hip hop artists, individual or groups that you listen to that inspire you so that you can do this work and just just get going and feel inspired? Is there an artist or individual group that you listen to?
So
Hip hop artists.
I know. You like. So I'm gonna. I could probably maybe think of somebody that I and pretend that I listen to that person. So I have a 20 my 26-year-old grandson is at Virginia State, and then
Okay.
my daughter, I remember like I'm 64, right? So I
Uh-huh.
kind of remember my daughter started being into hip hop music. I was like, "What are you doing?" Like I was in East Orange, like all this stuff was happening, and then it's
Yeah.
I would say in the last, and I can't even like right now my brain is like gone. I probably could if I could think of it. But in the last 10 years, but even more recently than that, it's been through public radio that I started listening to some interviews and like totally have been turned around about hip hop music as being, and then there's like, it's like being taught like Virginia State is like really, which is where my grandson went to school. Like there's like courses now, and there are all these books, and I am so behind. But like now, I'm really understanding the political aspect of it, and so I can't give you the names right now. But I am now, for the first time, really starting like to listen. And people are saying, I have this idea that just came to me. People are saying to me, what are you going to do next? And I said, well, I really feel like this book I've been working on this idea since my daughter was born. And now I think I need to like explore something else. And so maybe it's hip hop music, because I can't answer your question.
Well, maybe. Now, let me tell you something. No, that's
Or
perfectly
hip hop
honest.
music for birth. How about that? Birth?
Yeah, that's perfect. That's perfectly honest.
Zaid, how about each of us give her an artist and maybe she can go back? Because who's this? Black Power 19th Century. She has suggested Queen Latifah.
Oh yes. Well, see,
Okay.
you know what? I don't think of Queen Latifah as a hip hop artist.
Oh,
Maybe
really?
yes, but let me tell you about Queen Latifah. Queen Latifah's great 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 grandmother was a midwife in Virginia.
Oh,
And I started to do some
That's
research.
where I was going. Go ahead. Make the point.
But I think of Queen. I grew up in East Orange, so like Queen
uh-oh.
Latifah.
See,
Her
right
brother had his hair cut, all that stuff, and on Halsted Street.
That's why Halsted. That's right.
So I'm like thinking. So when you say I'm not even thinking Queen Latifah is like, I just think of her as like this amazing woman who, artist whose great 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 grandmother was his midwife. And I actually went to the church, not the building where she would have sat as an enslaved African midwife. I actually went to visit that, and it's the last thing when I finished this book. That story wasn't in the book, and I found out it was already at the publisher. And I said, "You've got to stop the presses, because I love Queen Latifah. I'm from East Orange, and we have her great 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 grandmother has got to be in this book." All right, so go ahead.
Oh no, but that's what I was going to suggest.
Yes.
Right, because they like Dashawn mentioned Sister Asa from Philadelphia, who's down in the DC area. I have a niece, my first niece, Crystal Charlie, who's been on the show, who's a doula, right?
Yeah.
And there's always been a fight for the soul of hip hop.
Yes.
The commercial industry has, certainly tried to, use that as a tool to help criminalize our community, right? But as a consciousness raising art, it can be a bridge to create spaces to have these conversations about why we should be taking our health seriously, and what are the cultural foundations of how we have taken care of each other in spite of some of the most vicious dimensions of oppression the world has ever seen.
And
Exactly.
Zaid, I just wanted to add Lauryn Hill.
Well, I don't know her.
And I also wanted to add Tiana Taylor.
Okay.
Those two.
Yes, yes. But that's an idea, though. I think that's a good idea to think about. The soundtrack for doula's birthing and all that kind of stuff. To just kind of think about those ideas too. But I think that and I guess that's the important thing about what's happening now. Like, right? Like the midwives were, that I interviewed in Alabama, they were, Jesus folk, right? So when they did their humming, they did their, their those songs that brought them peace. They brought those songs into the birth, and on the continent, that there was music around birth, right? There's just that's who we are as people.
Yes, ma'am.
So I think thank you for that.
And when I think of Lauryn Hill, I think of her song Zion, and her baby Zion is probably a grown man now.
Yes.
Yeah, but she wrote about her baby when he was a baby. So
yes. Yeah, South Orange, right? Yep.
Yep, there you go.
Great. I never would have thought, like, I was like trying to figure out when Willa told me, I said, well, I don't even know about the show, but we probably know, like, we didn't even get into the whole Alabama part, and there's probably lots of crossroads here that we haven't even explored.
Oh, sure. Like I said, there's many others that I wanted to touch on, but we'll have to have you back.
Okay.
And if we can make that connect with you for Source of Knowledge Bookstore, that could
Mm.
be the occasion to certainly do that. And if you have anything that you want to share with our audience, you can certainly just reach out to us so we can make that happen too.
And
Right?
also repeat about tomorrow's event.
Yeah. So go ahead. Yes, indeed. And we gotta bring in our next segment. I guess it's been waiting patiently. Tomorrow is at the library at what time, Linda?
Noon, noon to 2.
Okay.
Noon. I will be in
Yeah.
conversation with the midwife. We know that there will be doulas there, there'll be midwives there, there'll be mamas there who have given birth. It's going to be a conversation. We're going to, there'll be time for questions and answers. But I am very much looking to it, and I see it as a movement, a birthing justice movement, and that this book is a part of that.
Plainfield Public Library is at 800 Park Avenue, Plainfield, New Jersey, the home of the P-Funk, the bomb. All right. Thank you, my queen. We're going to be in touch with you. It's been a very full session. I'm glad we finally made the connect. Give Miss Willa my most loving regards. She's indeed the most prized elder that we all are very possessive and appreciative of. And,
Yes.
and continue your journey. It's a much needed reclaiming journey. Thank you so much for being with us.
Thank you so much. Thank you.
You're
Bye-bye.
welcome.
Thank you.
Matt. You can unmute now. We're ready for you, man. We're ready for you.
Yes, we are.
And Matt, jump right in there. Are our boats disposable? Go on.
Yeah, can you switch me to the other? My computer just told me it's going to restart, so I connected on my phone.
So what did you need to do?
He's in here twice, so cut him off. So Matt, sign out of here, and we'll
Okay,
see your
I'll
other one.
sign out now.
Okay.
Or just X out. He could have X'd out and still.
Yeah.
continue.
Now you should see him somewhere else. You should see him again.
He'll come back in. I only saw him once. I didn't see him twice.
There he goes.
All right.
There he goes.
I read that, Matt. I read that.
We did a wardrobe change.
Sorry about that.
Mr. Matt, I read that article.
Let's introduce him first because this is his first time on, right? And ladies and gentlemen, I want y'all to receive Matt Dragon from Our Revolution, and you're the Essex County branch, right?
Yes, yeah, and statewide as well.
Chapter, right? Who has been with us in the trenches on a number of fronts. You see a lot of the important rallies and mobilization of the People's Organization for Progress. You see Matt. You see us raising hell around the question of police accountability. You'll see Matt. The question of holding our leadership officials accountable. He hasn't just dropped. This ain't his first op-ed that's driving this conversation. He's dropped several others, and he's been a very consistent presence for progressives in this state that we appreciate. So welcome to All Politics Are Local, Mr. Matt Dragon. Now the op-ed that we're talking about, and I need to pull it real quick and put it on our YouTube page. And I want to apologize to everybody because I'm still out of most of my social media space. I got evicted a little while ago, and I'm trying to catch up and work around that. I'm gonna put that on I'll post that on our YouTube page, and later on it can be posted on our Facebook page as well. But you penned a very important op-ed that we want to talk about. So just tell us just to set this off, why you felt it was so important to drop that now. And what was this Jersey? What's going on in Jersey with our elections? What's happening? Why is this so important? What are we trying to fix? What's broke?
So I originally wrote this op-ed sort of more specific to LD 27, which is my state legislative district. Includes Clifton, Livingston, West Orange, Montclair, forgetting Roseland, I think, is in there. So originally, after the redistricting last year, the redistricting committee put Senator Nia Gill and Senator Richard Cody head to head, both in LD 27. So Senator Gill had previously been in LD 34, and now they were double bunked in 27. And as part of that process, the Essex County Democratic Committee, but really the chairman, Leroy Jones, assigned the prominent ballot position to Richard Cody, and that allowed him to win that primary. Before, or sort of at first pass after redistricting, they were going to run a ticket of 3 white men, all of them over 65, because Assemblyman Giblin, Assemblyman McKeon, and Senator Cody was the ticket for LD 27. That would have been the first election post the Dobbs decision at the U.S. Supreme Court around abortion, and it was viewed as kind of not with it that you were going to run 3 white men, particularly with Assemblyman Giblin being one of the few Democrats at the state level who was not supportive of abortion access and abortion rights. So they dropped Giblin and they replaced him with a Latino woman, and they ran that as the line, and those folks won. They beat Senator Cody beat Senator Gill. That was in June, and then I think it was early August, Senator Cody announced he was retiring. And when Senator Cody announced he was retiring, the Essex Dems decided to completely scramble the line. So they took the winners of the primary and they shuffled everybody around. They elevated McKeon up as senator. They brought in County Commissioner Brendan Gill and tried to put him in as an assembly person. And then they brought in an additional assembly person, a different Latino woman, this one from Livingston, because Brendan Gill and the original assemblywoman were husband and wife, and they thought that wouldn't fly to have both of them on the ballot. But they decided to have the husband on the ballot and kick the wife off. So this caused a lot of unhappiness, I would say, in the district. And so I wrote this op-ed highlighting that if that plan had succeeded, the folks on the primary ballot would have not gotten a single vote in their position on the general election ballot. McKeon got no votes as senator because Cody was on the ticket for Senate, and so on down the line. There was enough public pushback that they sort of reversed course and they put back the original assemblywoman. So now LD 27 is represented by a white man and 2 Latino women, which is obviously a step in the right direction. But that whole process, sort of got the line and Essex County some unwanted attention. And then you may have heard more recently that Governor Murphy's wife has decided to run for Senate. And I think it was within 2 days after she announced her candidacy, she had already racked up 5 county endorsements. And just to explain a little bit about the line, so on the Democratic primary ballot, everyone on that ballot is a Democrat. And what they do is the county will group people together that are their chosen candidates, and that's what's called the county line. And whether that's the first line, the first column, or sorry, in Essex County it would be rows. So the first row or the second row, it's usually the only complete row that runs from side to side or top to bottom, depending what county you're in. So that they've studied this ballot design. It is unique to New Jersey. No other state does it. It would actually be illegal in every other state to try to build a ballot this way. And what they found is in a U.S. House race, I think it was in 2020, it might have been in 2018, the person who got the line got approximately a 30% bump in votes. And the way they did this was 2 different counties neighboring one another had the same candidates, but in one county, one person got the line, and in the other county, the other person got the line. and their votes were bumped by 35% up and down, depending on which of those two counties you were looking at.
Let me stop you. Let me stop you for a second, because you lifted up a lot in just a few minutes, and you also lifted up about some folks who we know in this community, and I particularly wanted to have Donna to have a chance to have some input and some insight on what you just raised, because we're going to lose her in a few minutes, right? So Donna, and he mentioned how this deal was not a good thing for Nia Gill. Remind everybody who Nia Gill was to this selected community, and what she meant to us, and what we lost as a consequence of that, and only for Cody to go ahead and retire when he should have just got out of the damn way in the first place, if that process was going to go down. But go ahead, Don. We want to hear your thoughts on this before you go. You're muted, Donna.
Nia Gill has been a consistent voice in our community, and she has sat, I believe, on the committee on for jurors for probably the last several years. I can't even count, but she has been a voice there when it comes to us picking our Superior Court judges. But did I hear you in the beginning say that the first line was Governor Cody, Nia Gill? Go ahead.
No, it was Governor Cody for Senate, John McKeon, and Assemblyman Giblin for Assembly.
And running against?
Running against, well, at that point they were running against no one, because that was before the ballots were even printed, before the field was even fleshed out.
Okay.
So I don't remember if they had any challengers at that point.
At one point, Governor Cody was running against Senator Gill.
Yes. So the at that point, when sort of all the filings were in, Senator Gill tried to keep her Senate seat, or run as the 34 incumbent in 27. So yeah, they were head to head, Cody and Gill on the primary ballot.
But had Governor Cody stepped out at that point, then without Senator Gill would have been the chosen person.
Yeah, I mean, it'd be hard to imagine a scenario where that wouldn't happen. Yeah,
that wouldn't have happened. But it was almost as they strategically kept her out, ran Cody against her. Then Cody announces, and then they get to pick who they want, as opposed to giving her the chance to run a fair race. Is that what happened?
That's not what they would say would happen, but that's certainly the appearance. That it's hard to deny that Nia Gill, John McKeon Senate primary would have looked very different. He would not have been an incumbent. But yeah, now he's the senator in waiting, and she is out of our elected representatives. So
because they strategically positioned that they ran her up with two household names and one with a family household name that went a little bit further than Senator Gill. So I think that it just, and I don't know if you met and have seen the numbers, but one of the things about Essex County, we don't come in at 100% for various reasons. We stay steady about 30, 35%. And that's because people are just not engaged, inspired. But had we perhaps run a inspiring, and they do that also strategically as well, not inspire um, the voters to get out and vote at a time, and then explain it as well and educate as well. But had we explained that the districts were being redistricted, and as a result, this is what's going, if we step by step and let people know what was going to happen, and then give people, and I'm sure people still, it doesn't hit them until it hits them. Like people will probably go looking for Senator Gill's office and want to ask her a question like, what do you mean? Like they just they really don't get it until they get it, because there's a sense of trying to keep um, the voters ignorant to an extent, or um, and ignorant might be a very strong word, but probably trying to keep them out of the know. But ignorant is and I don't know what we can do to get way back to grassroots. And one of the ways they did it, I believe, Matt, is by stopping and putting voter headquarters when it comes time to vote. Because when people physically see something in a neighborhood, they can pick up their paper, they can see it, and they can see it in the community. Now it's all relied on commercials and being in the know. And if you don't have the time, number one, to watch the commercial, or you don't have the right channels for the commercials that are playing on, and then you don't even realize that these elections have snuck up on you, that you're kind of just, these new candidates are just put upon you, and then you just have to deal with it until you get used to it. And it's unfortunate because um, Senator Gill has done the work in our community, and she has been there for her constituent base, um, and 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 doing work at, you know as you say, doing it at yeoman's job, and people don't understand. That's, picking up phones, showing up at doors, showing up here and explaining, and it's a lot of work. And then when it comes to, and it's very hard to be an incumbent and to do the work and to run an election, and then to run up an election when they are purposely trying to remove you from office. So it's very unfortunate, and I would even say that it's even unfortunate to the person, as fortunate as the person who may have the opportunity to step into these shoes. It's not that very fortunate, because now they're going to have to pick up and 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 do and probably do the work that they're used to getting from Senator Gill, and that's very hard to do because they're not Senator Gill. They don't have the longevity that Senator Gill has had, or a staff with the knowledge. Perhaps they may inherit, Senator Gill may go ahead and give her blessings, and a person may inherit. That's one thing you may hope for, that they inherit some of Senator Gill's staff who could carry that new person, um, carry them, until they can catch up. But it's something that is very disheartening, that the respect isn't given when you're doing the work. It's one thing not to be doing the work, but to be doing the work and not to be given the respect to be entrusted to run that line, and to run it, uh, and to be given a fair chance to run. And it was purposely done, because I'm sure Governor Cody knew he was going to retire. And why? And we're asking why at a time that we shouldn't be playing with any votes out here, because right now there's a lot of things that can be going on in our country, that if we don't have educated, civic minded voters out here, and sometimes by our own doing, that a lot of things can happen in the next couple of years that we all may be very shocked with. So
Yeah.
it's just horrible. And I don't have you had an opportunity to hear a response from Senator Gill?
Yeah, the group that was sort of trying to oppose this did reach out to her to see if she was interested in trying to challenge for the Senate seat once Cody retired. But I think she, she wanted to sort of respect the process and sort of felt like, I'm not to put words in her mouth. I'm sure she did not feel good about, getting forced out. So,
Right.
I don't blame her.
And what is the opportunity of her running independent? Could she couldn't do that?
She couldn't. There was a big confusion about there's a sore loser law that's common in a lot of states, and New Jersey has one as well, where you cannot lose your party's primary and then run as an independent because it's seen as a risk of sort of spoiling the election. It was not clear if she would have been covered by that law or not.
Okay.
Because of it being a special case that they weren't. If Senator Cody had not retired and taken himself off the ballot, she could not have run as an independent because she ran in the primary and lost. But now the seat was open and it was sort of running under a different process. So it's probably something that could have gone to the courts, but it was not immediately clear whether or not the sore loser law was intended. The words on the paper, it was not clear if it should apply in this case or not.
Yeah, but is she really a sore loser, or is she somebody that was cheated out of an opportunity to?
Right.
Yeah, And I'm sorry, because I have to catch a 9 o'clock, but I do want us. I'm a fan of civics, and I think I think over the next year or two, we almost need to do 20 minutes of civics all the time so we can hammer it into our community, the importance of them knowing. And I'm one that I really want to get back to basics of just doing it the old school way. 90 days prior, open up a campaign headquarters, let people, because I think even if there was and am I correct to say that there was no campaign headquarters for any of them?
I'm not sure. They'll often do like an Essex headquarters, at a few locations that are like all the candidates, and then they'll run phone banks and canvases out of that location.
But not in immediate community.
I don't think like in every town, even much less in every community, for sure not.
Yeah. Okay, well, Matt, we're going to be talking soon, as y'all consider, because I got to get back to this transit. But thank you for coming on, and please continue to come back. And I think all the way up, because this is going to be an ongoing issue all the way up to the presidential election. And as you see, even just what happened in New York, and I think even with the Santos thing, that Governor Hochul, she's going to have to pause because there's probably going to be, I think they said, another senator retiring. So how that timing's going to be. But we're going to have to encourage our community. They're going to have to keep their hand and on the pulse, and they're going to have to be in the know so that these things won't continue to happen. We have to get our community excited, engaged, and educated about what's going on in our community when it comes to our local elected officials, because it's very important.
Okay.
And thank you.
Okay.
And see you guys next week.
All right.
Okay. All right.
Take care. Take care, Mr. Williams.
Thank you.
All right, Donna, be safe.
Okay. Thank you.
So Matt, let's bring it back to how we gonna deal with this, right?
Yeah.
Because we ain't gonna just warn folks about the line. We're trying to change this, right?
Right.
Tell everybody about the work that our revolution is doing. Your other allies and trying to challenge this line. Ryan Haygood from the New Jersey Institute for Social Justice, for instance, just dropped another op-ed just recently as well, right? And so what are the challenges that folks should be looking to join to end this process? And we got to understand too, we're not talking about Dixiecrats in the 1950s.
That's right.
We're talking about a Democratic Party in the blue state, the progressives,
Right.
Right? Phil Murphy's crew and Coughlin and the gang, right? We're not talking about a deep South. We're not talking about crazy ass Republicans. We talking about folks that are, in your district, the 27th is one of the richest districts in the state.
Yeah.
On top of that too. So there's a lot of hill, a lot of levels to this. But let's unpack what is actually happening to undo this old practice of privilege that
Right.
needs to be addressed.
So yeah, there is a lawsuit that's ongoing, and New Jersey Working Families Party is one of the lead plaintiffs in that lawsuit, as are some other local candidates, including one of the Our Revolution chapter members who ran off the line for county committee and ended up winning. So there is that lawsuit. It's moving forward. The parties, both Republican and Democratic parties, have tried to intercede to kill it, and that has not worked yet, which I think has surprised a few folks that they haven't been able to just get it sort of dismissed out of hand. So that's one sort of line of attack. Another line of attack is going back to those county committee seats. So every town, you'll see it on your ballot in the off-year election. So this past Democratic primary, I think, but Essex messed up with COVID. The years got moved around. But so you'll see county committee members. Often there'll be 2 empty boxes because no one has filed in your district. So you could write yourself in. You could, get a little campaign of your neighbors to write yourself in, and you would end up on Democratic committee. And then you would have a vote at the municipal level around who your chair is at the municipal level, around whether or not you're going to endorse candidates at the municipal level. If you get enough of those people in place, you can get a chair who is sort of against the line, and then that person can, at the county level, start making noise and start creating some pressure against the county party to try to eliminate the line. Maplewood has, at the county committee level, gotten the party and the county clerk to allow them to list multiple candidates on the line. So any candidate that their municipal party endorses for their municipal elections, like their mayor is a partisan position, they are allowed to list 2 candidates for mayor, even though there's obviously only one position. So that's new. That only happened, I think it was last year in the primary. So that's sort of an important step. That's something that previously wasn't happening in Essex County, and now you've got a ballot you could point at to say, look, we've done this before. And then there's a number of groups statewide that have come together since Tammy Murphy got the county endorsements that will carry the line with them, pushing on both the candidates and the county chairs and all the way down to the municipal chairs to try to get them to not use the line in the Senate race, because the whole issue around the Senate seat has come out of let's say, accusations of corruption for Senator Menendez.
Menendez is a dog.
Talk about it, please.
So legally speaking, he is accused of corruption, but he is in that seat.
He's the lawyer in the mix.
he is in that seat in the Senate because of the county line. He got the county lines,
yes,
and that's what won him that primary to get into the Senate. He was on track to get the county lines yet again. So this same sort of system breeds the same corruption over and over again. So what the groups are calling for is just no line in the Senate race, and trying to get the counties and the candidates to sort of get on board with that. So those are sort of three different veins, trying to carve out this Senate race specifically, trying to get people on the county committee so that they can hopefully, accrue up enough people to really start being able to push, and then the lawsuit, which is sort of out of our direct control, but good, important for people to know that it's out there. And then just one other thing I would say, like at the individual level, the primary in New Jersey, in most of our districts, in most of our elections, is the election, because there are not competitive districts.
Which is the whole point. Yes.
So the like do the homework if you can. If you've got the time, if you've got the ability, research who's on that ballot, especially if there's somebody running against the Democratic candidate. The person on the line. If there's another Democratic challenger, do some homework. See if you can campaign for that person. See if you want to vote for that person, because that's really where the actual election is happening. And what you'll notice is all over Essex County on primary election day, you'll see big signs saying Democrats vote line A or vote line A Democrats.
Right.
That again, everyone on that ballot is a Democrat, but they want you to vote for their Democrats.
That's right.
Not your Democrats. So that's an example to what Donna was saying of it's not ignorance. It's sort of like, miseducation that they're trying to trick you into thinking that the only people that you should vote for are the people they've picked.
They do not call it the Soprano State for nothing. As we wind down this segment, because we got a young gun that's gonna get ready to come in on a hip hop segment in a little while. It just peeked in here. We've had Joe on before. We've had Joe Matrica on before, and Joe's been trying to turn it up on the Mercer County front, and that's a very pivotal front because it's the state house is in Trenton, Capitol is in Trenton. What are you seeing there in terms of challenges on the county front there?
There has been a little bit of movement there. There's been a few bills introduced, some from representatives who are retiring or on their way out the door to not allow the line or public statements against the line. Part of the problem here is you can't. Not to say you can't. It's been something like 25 years since someone has won a statewide, a state assembly or a state senate race without the line. So part of it is like you almost have to use the line to win and then, disavow it immediately afterward. But there are bills out there, with one or two co-sponsors. Not every county has the line, and it differs depending on the party in some of the counties. So there's some folks in Trenton that are, haven't gotten there through the line and maybe feel a little easier speaking out against it. But really just trying to, like you said, raise the noise and ramp up the pressure and try to get people to have to start answering questions about it. Letting people know that this is something voters, certainly now with the Senate race, are aware of and are paying attention to.
Hey, Matt, I was wondering if I could ask you a question before we end the segment with you. And I guess I'm asking the obvious question, right? In regards to one, how did Murphy's wife all of a sudden just get the county line? And then two, what does that mean for someone like Larry Ham?
So the general assumption is that some horse trading happened, right? So these county parties rely on money, and the Murphys, both of them are known to be prolific fundraisers. There's obviously a lot of the I mean, one of the problems with the system we have is a lot of these party chairs are also politicians. So they obviously have political interests where Murphy can headline a fundraiser for them or help them, stave off a challenger. And then obviously there's sort of the future looking impacts, right? Like if I give you the line and you end up in the Senate, then like when my county needs some roads built, or when my county needs more federal education dollars, I have somebody I can go knock on their door and say, hey, remember how I helped you get elected? So it has that sort of that deal making component and that maybe underhanded or under the table component that no one's really sure exactly who promised who what and why, but it does have that sort of you owe me factor the way the system works now. For Larry, I think it means it's just an even bigger challenge if you take that, even if you take that 35% and cut it in half and say that the line candidate is going to get a 15% vote boost. That means Larry has to meet, talk to, and impress 20% more people to beat that. I think it could, there is a scenario where the lines could sort of be fractured throughout the state. A lot of the big populations, though, big population counties have already endorsed Tammy Murphy. But in a scenario where the line vote is split between maybe Andy Kim in some of the counties where he's stronger, and Tammy Murphy in some of the counties that she's already gotten, that that does open some theoretical pathways where a challenger without the line could sort of capitalize on some of that splitting. But I think it definitely it's designed to keep people like Larry out of the conversation. They can keep him out of debates because he's not gonna represent a serious threat in a county where they've got the line. So it's definitely bad sort of for representation. It's bad for getting more candidates interested in the process, and all of that means it's bad for voter participation and engagement and excitement as well.
Yeah, I mean, one of the things that I'm hoping that folks unite and try and do is push for a debate of the Senate candidates, so that at least give him a shot to be heard. All right, because this is one of the most important elections of its kind in the state in a long time, and it deserves a full look. Deserves full. It doesn't just all due respect to Tammy, she's probably a nice person. I don't have anything against her personally, but it ain't about that. It's about the state, trying to clean up a mess of somebody who betrayed the trust and what folks in the state are supposed to stand for in a way that's disgusting. And we want something that is totally going to flip that, and represent what we really want. So integrity it should be one of the driving issues of this whole campaign in that particular election. So yeah, that's where we're going with that, right? Y'all want to ask Matt any follow-up questions before we ask him the ritual question?
No, we're good because we got our other we got our other guests in the background. So thank Matt for sure for coming through, man. We always appreciate your knowledge, Matt, and we're going to look to try and lean on you a little bit, man, as as we begin to get close to some of these elections, particularly with a statement that Mayor Baraka had made at the party that they threw down in Atlantic City, and also what he said on the mayor's forum, where he had said that he made a statement that if we can organize, then we wouldn't necessarily need party bosses who would be making decisions, right? But that the organizers who would be organizing and determining who their candidates should be, right? So, and I think
that's what you have to do.
I think that's right and exact, right? I think that's who should be making those decisions, not folks getting together, as you just said, Matt, and organizing and determine who should be that particular candidate based on one, if you have the ability to raise funds, or two, you promising me something. And
Right.
you may not be the best candidate. So we're going to look to have you back, man. You already know
Great.
the question we're going to ask you in regards to, we're a hip hop political radio talk show. So we're going to ask you, what you rocking to right now.
Sure. I think before one time I said the Roots, so I'll change it up and there was I guess it's the last Tribe Called Quest album because one of the members passed away. I think it's something like We Got It From Here, Thank You. It came out right after my dad passed away, so that one has always sort of landed special for me. So I'll say A Tribe Called Quest.
All right, that's classic, my brother. There's no doubt about it, man. So Matt, again, man, we appreciate you, and look forward to having you back. And particularly, it'd be great to have you back with Larry. Perhaps we'll have Larry on one night and have you come in, and let's see if we can analyze some of these particular things that are going on in some of these counties. And I'll leave you with this. If you can go back and look at the mayor's forum, he was on 2 weeks ago. And one of the things he talked about was, Matt, and this is good for a guy like you, he said that he's touring the states, right? He's touring the counties right now. And he said that some of what he was hearing from some of these party bosses was that white folks would not necessarily vote for him, right? Isn't that a hell of a thing to say to a popular mayor? So you might want to go back and look at that, and it'd be interesting to get your thoughts on how he responds to some of those folks who are saying that, because at the end of the day, he was talking about the issues, right? He wasn't talking race, he's talking issues. And some of the same things that are affecting people in other counties, Matt, he said are also affecting white folks too.
Right.
So why wouldn't they vote for issues? So we'll look to have you back, man. Hopefully we can talk about that on that level. So thanks a lot, my brother.
Appreciate it. Thanks.
All right. All right. So listen, man, we're about to jump into the hip hop segment. We want to welcome our brother to the show. I have not, Brother Lyle, I must say, man, I'm not necessarily familiar with your music, but I know that John, who had said that you probably one of the hottest young MCs coming through right now. So he sent me something that I guess it's perhaps I don't know if it's just your IG page, but it talks about the fact that you are a Plainfield, New Jersey native, is an MC who doesn't rhyme for the sake of writing, rooted in community activism and education. Lyle's music provides a politically charged, of course, we like that, politically charged and introspective yet reliable view, tracking topics on overlooked or taboo in hip hop. What does all that mean, my brother?
Okay, peace. First, I like to
Peace,
say
my brother.
Peace.
Peace, Baba Zaid. Peace to Sean. It's great seeing you, both of you brothers again. And pleasure to meet you.
You know, I know you. You're one of my native sons from Plainfield.
Come on, man.
Always good to see you.
I'm glad to see you out here, and you're still dropping it like it's hot.
Yeah, man.
Go ahead and answer the big
so
brother.
what's it mean? Like, first off, you said Larry Ham. I represent a group called Negros Americanos, and there'll be no Negros Americanos without People's Organization for Progress. We were part of the Plainfield chapter with Steve Hatcher. When we formed Negros Americanos because of Black and Latino beefs in Plainfield, and trying to figure out a way to bridge those gaps between the communities. So, at the time we were organizers in Pop in Plainfield, right? We had a peace rally after Spencer Cadigan was murdered on that corner. We had the mayor come out. We had a bunch of members from Pop. Cats from North came out too, the yellow shirts. It was beautiful. But one thing what we couldn't do was build with the Latinos. So we had to learn Spanish. So me and my brother Bishop, we moved to Panama and stayed out there for a year and some change until we learned enough Spanish to communicate and get around, and came back to get it popping. So that's my roots as an MC.
Do you realize what you're lifting up? let me stop you for a second. That's some loaded shit, but I want to say several things about that real quick. One, there is a burgeoning international discussion in Latin America around anti-black racism.
Yes, sir.
That's one, right? So two, you go into Panama to take a deep dive to get your Spanish on. Panama is a loaded space in the Black Latin tradition, right?
Very.
Mr. Garvey starts his printing in Panama, right?
And then he had in Costa Rica.
That's right, right?
Yeah.
Okay, all right. And he covered all of that territory. He had more chapters in Cuba outside of the United States than any other country in the world, right? And then we get Black Solidarity Day from a long-legged scholar by the name of Carlos Russell, who worked both with Malcolm and Martin. Straight out of Panama. There's a bad little sister who's up in Boston, who I love the hell out of, right? Who has got an organization, 2 organizations to be sure, right? An international organization, Red Mujeres de Diaspora Afro, sisters from Boston to Buenos Aires, turning it up on the question of race, racial dignity, and standing up against femicide too, because that's some wild shit in Latin America too, right? And that streets as well, right? And nationally, with being a bridge between folks speaking English here in the United States and folks speaking Spanish who are here from other Spanish speaking quarters in the United States with Encuentro Diaspora Afro. So there's some stuff happening that that you just described, that story you just told, is right on top of an international context that is trying to find some light. So you the way you get down, the way you've been getting down, is a hugely important story. So I'm glad you lifted that up, so we can build on some of that and let's keep riding. Ed, I know you wanted to do a follow-up question, but I had to put a pin in that because that's not just a Great Plainfield story. That's not just a local hip hop story. It's got international ramifications, and I wanted to lift that up.
My brother Bishop's carrying on the mission in Brazil right now. Because the Golden Negros Americanos, we were colonized by the British, the French, the Spaniards, and the Portuguese. So we're going to be able to communicate with our indigenous and African folks who've been colonized by those entities, and we could cross the water too. If you could talk to all of Brazil, and you could go to Angola and get it popping. You know what I'm saying? If you know French, you could look at all these islands over here, Haiti, and then you can go to Ivory Coast and wherever the French have been in Africa and get it popping. And we already know English. We can talk to our Nigerian brothers and sisters. So we're working backwards through languages in the diaspora. That's kind of the whole concept of it. And not because it's like a trendy thing, but it's survival. Our revolution is survival. It's not entertainment. Right. So even in the hip hop space, everyone shows up for different reasons.
So my brother Lyle, I'm definitely appreciating where you're coming from. So there's this conversation that's happening now that's being pushed forward as it relates to this young brother named D1. You familiar with that?
Yes, sir. Love him.
And of course, he's moving real strong right now with A-listed rappers, right? Who are now having to take a look at, the music that they're putting out based around some conversation that Dr. Umar Johnson has been putting forward, right? Like, how are you rapping about murder and the degradation of the Black community when you live behind gated walls and private drivers and all of that? And I just saw the other day where they had Rick Ross and the brother from Philadelphia. Y'all gonna love this, Zaid and Dashawn. They had both of them brothers, right? On 112th in Harlem, right? Trying to show that they can really hang out in the hood. Isn't that something? After that statement that was made what D1 was asking him, how can you rap about this music that neither one of you guys are living anymore?
That's right. That's right.
So I guess the question I'm asking you, Brother Lyle, one is how do you see D1? And then two, what do you think about that conversation now being challenged to those brothers who are affecting, right, young brothers and sisters who literally live that life? Like maybe they did at one point, but are no longer living because they're now behind those gated fences. But those young brothers are really catching cases and are really murdering one another.
Yeah. There's a level of responsibility that you have to have at some point. First off, D1, love him. Love him. He's our brother. And what he's saying, these are true facts that can't be debated. And that's why it's hitting the strings of these guys, because they know what they're cognizant of what they're doing. A person as smart as Rick Ross, right, who was a correctional officer, who took the name and moniker of a dude who did 20 years, who was the real Rick Ross, sued him, won the lawsuit, and he was rosé for a little bit, but he maintained that these are highly intelligent people and they know what they're doing. And to me, I just look at them as pawns. Some dudes aren't smart enough to articulate themselves, and they're spinning in the mud circles of their own ignorance. They're championing being destructive to their own people. I'm waiting for the real gangster to come out. Bring me back the scalp of George Zimmerman. Threatening D1 does nothing. Matter of fact, D1 should have just been like, my name's George Zimmerman. I'm auctioning the Trayvon pistol. I'm right here. I think a measure of, I guess, one's bravado, right? Everyone pokes out their chest to each other. We're Quali at the lines, like slaves on a boat saying who got the flyest chain. That's what I see. I see these guys as pawns. I see this thing is layered. Who funds Meek Mills? Who funds Maybach Music? Who makes sure that they get more exposure than a Lupe Fiasco? Same time Lupe was set, Craig Kalman, Atlantic Records, right? When we look up, these folks that are in charge of this music industry often don't even look like us. Often it's to no consequence. When you see that interview with Leo Cohen, and he was like, yes, we have others. They got locked up. We have others, right? These guys are just puppets. So like with D1, it was pretty sensational to hold these guys accountable and say, well, I'm talking to you. I expect more from you, brother. Especially if you get into a place where you can graduate. We see the detriment. T.I.'s son is wilding right now. T.I.'s son is wilding. He's like, bro, you grew up in the suburbs. T.I. was trapping. He's like, I did that, so you don't have to. But now you see how if you're saying, they say, do as I say, not as I do. But we do as you do. As kids, we're gonna soak up what we see, and we think that's real. There's a song by Nas called Rise and Fall, and he says, I'm not from Colombia, Nicaragua. Don't ship keys from Panama. Pablo Escobar's bloody reign came to an end. Far from my life, a kid who made a stain from a pen. Right? We have to hold these guys accountable. And for folks who say like, I'm just making up stories. I'm just saying what's on my head or whatever. You have to ask yourself, why is it entertaining for us to always be on the receiving end of the pain? I have an album I just dropped called Ugly Duck as Fuck, right? AF. And
we just put it on YouTube.
I put it in a little chat. Now, there's less niggas in this project than the average Quentin Tarantino movie. Okay, you'll hear nigga less times in my album than the average Quentin Tarantino movie. But you'll hear cracker. You'll hear cracker a bunch. And we have to start normalizing that. And when I say kill a cracker not on the prejudice tip, the meaning is derived from the crack of the whip. John Brown ain't no cracker. Amy Goodman ain't no cracker. You know what I'm saying? So when we're using that type of language, I'm talking about a cretaceous, low-life oppressor with weapons to neutralize safety, a clown, right? Someone cracking the whip, someone who's on the side of the oppressor, who's oppressing others. When we look at all these hip-hoppers and all these MCs, like it's tiered. It's tiered. There's something that's happening that's bigger than just the Jim Jones.
Sean, I'm surprised you ain't jumping in now. Who is your former leader, sir? That speak to this vibration that this brother just lifted up.
The Honorable Black Power General Dr. Khalid Abdul Muhammad. I was gonna jump in. I was waiting for you, Zahid. I was waiting. I didn't know who to. I was waiting for you to mention. And even hold on,
in gray and white.
Hold on, but Zahid, I was waiting for Ed to do that. I was actually waiting for one of you. You know, right away, I was gonna summon the spirit of Khaled. He's already here. I was waiting for one of you to do that. Anything that's in sight, it ain't right. Okay, never mind.
All right, we had to now. We got to lift that up. Yeah, yeah. Keep riding, Lyle. You were saying. Go ahead. Keep riding.
Yeah. I think it's unfortunate to like when let's say a D1 criticizes the other rappers and is trying to hold them accountable for them to threaten his safety. That's some house nigga shit to me. Yo, Zimmerman's walking around laughing. Kyle Rittenhouse was taking pictures with the president. Right. Okay, you want to show you a gangster bang for your people, half your people, but not against chilling in front of his desk.
Against are you? That's right.
You know what I mean?
If you must bang, God damn it, bang for freedom. Yes, sir.
Yeah, dead prez. If you're gonna bang for change. Don't bang for crazy things, and if not, don't bang. Can you dribble a grenade to save your life? Dead prez, man. I'm oriented like my big growths in hip hop that I came up under. It's like Hassan Salam, CF, Brother Majesty, right? These are the folks that would be in a stronghold with Immortal Technique. So they did things, you know, they were about stuff. Yo, one of my highlights in my life was, you know, being able to perform at a fundraiser that raised money for the legal defense of Russell Maroon Schultz. Like that type of stuff to me means something in terms of like, what are we doing? How are we spending our time? What are we putting our efforts towards? You know, I think more can be achieved in terms of bringing the Rick Ross together with the D1s, but folks need to be held accountable. And I think like we should be able to have opinions about each other without stuff just escalating to violence. And again, I think the quickness that we have with attacking one another, it you know, it's evident of a house nigga mentality, in my opinion. Because like, yo, for example, right?
I was going to ask you that. I was just going to ask you now because you're halfway into the answer to the question already. But this is the 50th anniversary of hip hop, or so if you accept the general chronology of how that goes. You know, the terms of tagging and whatnot it's a bit older, right? But given what you're talking about, the contradiction that we're talking about right now, right?
Yeah.
In its 50th year, right? How can we two things? One, steal back the soul, right?
Yeah.
Back the soul, right? And set in motion at last. I mean, 50 years old, you need to be mature enough to stop doing some of this shit. Right? Right. So I just wanted to get your vibration on some of that. Because you're really into that already in terms of what you were saying, but let's build it out some more.
We gotta destroy all demons. We gotta destroy it and rebuild it. The wrong Negroes took the reins. They're driving the ship into an iceberg. Okay, and it's just a small group of them. You know, Ted Kaczynski had a article, okay, named "Ship of Fools." It's a little short story called "Ship of Fools," and it's about a ship that's traveling north with all these different groups of marginalized people on it. And I know the dude was crazy. I know he did a lot of wild shit, but I'm just speaking about this short story to put it in context. Okay, I don't follow him. But the Ship of Fools, we got a ship of fools in hip hop. And for it to be around for 50 years, you know, the originators should be way better taken care of. Yeah. You know, I think when corporations found out there's money in this, and those same corporations who are in bed with or major investors in privatized prisons, what we have now is advertisements for lifetime hotels. You know what I'm saying? Right. And so it's being used against us. So I feel like a Jedi against a rebel empire where, yeah, they might be decorated. They might have their shiny suits. They might have all these things. But, yo, Luke Skywalker's going to come. Neo is going to come. And he's going to flatten out all of them. Eventually, it's going to happen. The real shall rise. I don't think their reign will be forever. And I just want us to be evolved to the point where we can differentiate between the real and the fake, where we see a joker as a joker and not as a leader. Because like it's just wild to promote something that you ain't even doing yourself. I'm trapping. Your kid's in private school. You're at home. You got a maid. You know what I'm saying? Maybe at one point you was trapping, but talk about that graduation. I love Nas' last album, King's Disease 3. Track 2 or 3 is Go Legit. He has a song in there called Don't Shoot Gangster. Nas is an example of graduating, evolving in hip hop, not doing the same thing. Right? He's been shouting out the OGs, had a paid in full thing where he's shouting out Rakim, Scarface, giving awards, right? There are some folks doing the work and doing it right, you know, to help out. But yeah, we're in danger. But there will be a Rebel Alliance. I'm as long as I'm alive, I'll be a part of it.
Yes, sir. Yes, sir. Yes, sir. Dashawn, you too quiet.
Well, this is the thing. When I see this brother, I'm not at all. There's a word I'm thinking pessimistic concerning the future of rap and hip hop. This brother here represents the resurrection, because you know, and as I said on this show, I believe it was on this show a few weeks ago, I witnessed hip hop and rap's demise 30 years ago when I was a teenager. You know, that summer, 1993, when I was 15, going on 16, and the release of The Chronic. And I started seeing it. I said, I said, here we go. And by 1996, it's very sad that and I noticed this as a 19-year-old, by 1996, I was saying to myself, wow, we have to make the distinction now between positive and negative rap. At one time, you didn't have to do that.
Yeah.
But what was considered to be negative, positive rap, that was quickly becoming a memory by 96, 97, 98. But actually, will allow you represent the resurrection, or you know, you represent that Ra, or that, you know, within Kemetic culture, you know, you represent that resurrection. You're like the Heru, because you know you're
take it all the way back to the beginning of Black.
That's right.
It's what they did to my father. You know, my dad died last year, a year ago, around this time. I just lost my uncle today, this morning.
Sorry to hear that, brother.
I'm gonna die on my feet.
Being here for real, given that background.
Destroy all demons, Dad. I promised him on his deathbed to do a couple things before I'm out this piece, you know. And one of the things was, you know, get all these ideas out, all of them. And I think this is part of it. And I got a plan, and it'll be rolled out relatively soon. I just dropped Ugly Duck as Fuck today.
Yes, tell us about it. Tell us about it. What's next with that?
I mean, so Ugly Duck as Fuck is just it's a chapter in my life of a period of where, you know, I got fired from my job, girlfriend left me for a dude doing yoga, and I got
you said doing yoga.
Doing yoga, man. I meditated with this dude, man.
Lyle, listen. Can I just interject, Lyle? You saying that? Listen, I don't want to mock you, but you saying that it sounds like a comedy. Like you have a comedy about I lost my girlfriend to a Tai Chi instructor, that type of stuff. That's what it's. I didn't mean to laugh, brother, but it's not.
Yoga niggas, man. Meditation bowl last night.
Yeah, I was waiting for that.
Yo, don't touch my girl, bro. Downward facing dog. Yo, back up. You know what I'm saying? But yeah, you know, pimps. Every pimp though got a Cutlass or a Chevy or a Perm. You know what I'm saying? It's some chakra pimps out here. But yeah, yo, Red Fox, Richard Pryor, Eddie Murphy on my wall. I watched Saturday Night Live Saturday night with my mother, 60 Minutes too, and then the next morning we watched Like It Is. That's how I grew up.
Yeah,
my idol, Gil Noble.
Come on, man. So like, here's the deal: when you know better, you do better, right? So like, I never owned nigga. Like, we was never called niggas in the household. My mom's like, nigga, get your... She never said that. Matter of fact, she made me read nigga when I got suspended. In middle school, when I got in trouble for fighting, she made me read nigga by Dick Gregory and write a book report on it. And you know what she used to do? She'd be like, you'll read chapter 1 and then write a summary before dinner. You don't write your summary? You don't want to eat.
Hungry. That's right.
So she's making me read, nigga. I did great reading in middle school, but that oriented me because like then I'm like, dang, yo, we got it way easier than son had it, you know. So like I'm like, man, I kind of have to do a little more, you know. I know everyone's going this way and doing that, but that's not who I am. I had a teacher named Joel Plummer. He used to work at the high school and he's at Paz and he teach at Rutgers. And I remember he told me, he's like, yo, stop pretending you're ignorant. He told me that in 10th grade. He was like, yo, stop pretending you're ignorant. You way smarter than you pretending. You rolling with a pack that's, you know, spinning in the mud circles of their own ignorance. But that's not you. You have to try to be ignorant. Some people, that's their disposition, you know? So I think it's worse when you know better and then you choose to do wrong. Choose to be ignorant. So I think, you know, my retribution or my judgment day will be, you know, 10 times worse because it's like, yo, you had the knowledge and you chose to ignore it. You chose to be ignorant, you know? Go ahead.
So, Brother Lyle, we're about to run out of time here, but I wanted to ask you, man, did you get a chance to see my son's freestyle on Sway?
I didn't. I just saw the sign and it said best freestyle ever.
I saw it.
He was killing. I'm gonna play some of that for you, man. I got it right here. I want you to hear this and how he's just, you know, we had him as a guest, man, and this is a continuation and basically how, you know, what D1 is coming, but how his guy, you know, who went to jail, man, when he had signed $1 million contract himself with Def Jam. Check this out.
Please, God, forgive me, but I refuse to be oppressed. So all the disrespectful views will be addressed. The wrong dude to even test, because I'm not going to fail. When the war is on, and I'm not going to chill. These cowards destroying the culture. They not going to build. Talking all this murder one shit, you not going to kill. Ain't got no skill or nothing. Just running your mouth till you run up on a nigga. Till you run in his mouth. It's something about this internet to give a coward courage. Till they get 6'9" and then they be embarrassed. But I'm just here to flourish. Growth and positivity. Try to show these youngins all the possibilities. Thank God for giving me the vision to see. King, leader, the God that was living in me. The shit you can see when you look good. I swear, the streets taught me way more than any book could. Yeah, I look hood, but I speak like a scholar. And my pride too big for me to swallow. I swear, for $1, these cowards are fold. They'll sell everything, including their soul. The truth will be told, so either you gonna listen or not. At 16 years old, I used to listen to Pac and think, damn, this brother is deep. See, I always been a wolf, I couldn't blend with the sheep. Used to pretend I was asleep, cause woke wasn't the status quo. Then I said, fuck what they think. It don't matter, yo.
Come on.
I drop
it. What? See what I'm saying? See, I mean, I think that's where we got to go right now, man. Right? Because I think that, you know, you talking about all that corporate music and you mentioned T.I.'s son. He's confused, man. Yeah. Right? He's confused. He has no idea of the life that his pops is rhyming about. Right? He has no idea what my son is talking about, you know, coming through, you know, in the Bronx he know about. No idea, man. And that's beautiful information that you're talking about. And this is where I think hip hop has to go, man. Particularly if we're talking about the culture.
You know, brothers, who I missed today, I wanted to tell you I was supposed to, Zion, I feel bad about this, but I overslept. I was supposed to go to the United Justice Summit today. And, you know, Fat Joe was there. He was scheduled to be there.
My job, we were there last year. I don't know why. I'm talking about my job now. I don't know why they didn't go this year, but we were there last year.
Right. I was supposed to, actually, Zion, I think you were the one that I found out from, you know, a few weeks ago. But I actually wanted to speak with Fat Joe about what we're discussing now. That was my goal. You know, I have my camera ready. It's just I don't realize I was that exhausted.
But Lyle, let's get your view on what you just heard, my brother.
Oh, my son. I love my son. My son Lennon. First off, I feel like there've been a lot of rappers coming at him, just real wild, disrespectful. And like certain people shouldn't have the right to say certain people's names, yo. I feel that like completely, you know, with his work with Until Freedom and beyond. You know, that's he's always been on the right side of history. And to me, I feel like, okay, if my son could do it, so many other rappers could do it. We about forming fists here. It ain't about anyone. You know what I mean? We ain't gonna get it done by anyone. We gotta form a fist. So he represents the BX, right? He represents the streets. He represents the people. He's also been inside, and he can appeal to the folks in the abandoned nation as well, the man keeper. So my son is an ally. He's somebody that's much needed, and we need to raise his voice more. There's a lot. You know what's crazy? The idiots be screaming and shouting and be strong and wrong, right? And the ones who have the best messages are often suppressed. I'm trying to think of who said the quote, but it was something about like, your oppressor is never going to educate you, especially to revolt against them, right? And we look at the educational system, that's what it is. It's training you to be a cog in a machine. Yo, we were being politically oriented, right? Deshaun, you talked about hip hop in the early stages being politically oriented. Oh, they found out that. They're like, oh no, these Negroes, I don't like you listen to Wise Intelligent. You listen to Wise Intelligent, you might get together and revolt. Nah, we're gonna literally replace Wise Intelligent with Young Thug. And yo, you know what's ill? Where's Young Thug right now? He's incarcerated. He's in the man keeper. Who managed Young Thug before he went in the man keeper? Leo Cohen, 300 Entertainment.
Ooh, the blood
What
sucker?
you did to my artist was bad. I have others.
Who was the 10%?
Disposable Negroes.
Wow.
Blood suckers of the poor.
I feel like in saying some of these names too could be burning bridges in the music industry, but fuck them. If they're Zionists, if they're racist, fuck them. I'm not even trying to go over there. I want you to know I'm diametrically opposed to you. It's a bridge I don't care to cross. So also, I won't be muzzled by it. You know? So so many of us are like, oh, we can't talk about, we need this. Yo, it's the most corniest non-hip hop cornballs that are ending up like running this thing. And at the end of the day, they'll make money off of your dead carcass, put off an insurance policy on your life, right? And then go hand the bag to the Vanguard group, the CCA. Continue to make cash with these privatized prisons.
That's right.
So I think we just need to come wise to the game. There's this ill article, Davey D and Homeboy Sandman. It's called Jailhouse Rock. And it's on private prisons and hip hop, Jailhouse Rock. And there are all links in there that just show Vanguard Group, Clear Channel, Viacom. You can say Hot 97 or Power 105. Yo, they're owned by the same company that's donating to private prisons, dog. We in trouble. So to me, it's all an advertisement for the lifelong hotel. Try to keep us in the man keeper.
Well, listen, man, we want to appreciate you, my brother, for coming through, man. You know, too bad DJ Rhino is not here tonight. You know, we'd love to, introduce you to that brother. But listen, man, if you got any bars you want to spit before we go, man, we'll give you, an opportunity to drop some freestyle.
All right, this shit's called White Fragility Test. Yo, ain't with the back talk, lame better back off. Matt, I call you cracker, but you love to paint a black folk. Jam to it, dance to it, offbeat, you jack off. Nick Cannon looking for the smack off. Don't give a fuck about Leo, I ain't signing no cracker. Copied us, now Yakub is designing the cracker. Crackers think it's all peace till I'm lining the cracker. Clan hoodie silhouettes, outlining the cracker. Now your daddy dead, Fetty for the Grand Dragon head. The beeping on way before any plasma shed. I shed light while you take a ride on the Lolita Express to Little St. James. And if they in vicinity, make sure they feel the pain. Retribution for atrocities. Now you are slain, you could bet it's loud. Finger snap like the neck of a dead pedophile. Dump them in the now. I may not be here. I'm feeling like I might just leave before I start a fire or a fight. 1,000,000 gorillas with some Molotov thrillers who remember the Steelers who are coming to ignite. The toupee wigs of those who abuse kids. Perform rituals where they tie your wrists. Summon demons, mix blood and semen. I pour on holy water in my super soaker squeezing. Until ain't none of them breathing. After that, I'm leaving.
There it is.
Small rock hit an Israeli soldier on his shoulder. Qasim prayed for a boulder to crush him because the state had treated him disgusting. Moved him out his land like it was nothing. Blasting and busting. Now a mother lays departed, courtesy of a tool of Lockheed Martin, stockroom, piled in with weaponry of violence. Your destinies eventually sanitary silence. They develop in a hybrid to replace a current epidemic level virus, which was tested in the islands. A remedy was found. A new virus comes behind it, blinded. My community's blighted Urban renewal. Now some crackers want to buy it. My psychic advices. Grab your Corona. Ignite your gasoline. Drench rag in your throat.
That was certainly fire.
All right, my brother. Listen, man,
you're on the case. Lyle, you're on the case.
We definitely appreciate you, man. We gotta have you back when DJ Rhino is here, man, and also Hawk, man. You know what I mean? Hakeem Hawk, man. So you know, to definitely have you through, man, and talk that. Yeah. So, Mr. Zaid, let's go on and we want to definitely thank the Congressman for coming through tonight, and of course, bringing the doctor with him, man, and we appreciate Dr. Fakorede for coming through. We definitely appreciate that, and you want to thank the sister for coming through.
Yeah, Linda Holmes, who's going to be in playing for tomorrow. Elder on African birthing traditions. Going to be at the playing for the library tomorrow at 12 noon. Safe in the midwife's hands, and then we just had from our revolution, Matt Dragon, who's been getting on the nerves of the Democratic machine up and down the damn state.
That's right.
And you know, blowing up this whole question around the so-called county or party line. Strong stuff that our revolution is doing, trying to change that, along with some other allies. And you closing it out with a fist upside a cracker's head. Right on.
Right on.
It's a
brother, we definitely appreciate you, Brother Lyle. We thank you very much. And so let us just ask you, man, when you're not listening to your own stuff, what are you listening to, man?
When I'm at my low points, I listen to Jay Electronica. I love Jay Electronica. His music, it's the wind in my back.
My daughter loves it too.
I used to hang out with him. I used to hang out with Jay.
Yeah.
Man, good brother.
Right?
I was upset with him over Erykah Badu, but that's another story.
Oh, yeah. But yo, I mean, I don't know the story, but like,
no, that was supposed to be me.
With the Rothschild. I heard he had his thing, a fling with a Rothschild. And to me, anybody who like, you know, puts a thorn in that family,
I'm gonna leave that alone.
I think that's pretty dope. Destabilize their family structures. Have them have some biracial kids up in there. So then they're like,
contradictions. That's right.
Yo, honestly, I want all the Tiger Woods, Wesley Snipes type dudes, you know, the folks who like the white girls or whatever. Yo, go up into Europe and, you know, populate.
No, that's not what happened. Hold on, Lyle. You got to remember what Dr. Clark said about the mulatto factor. That's not always the case.
Yeah.
Mulatto factor. That's not always the case.
Yeah, they come around, turn against us like they're other relatives.
That's right, Zach. That's right.
Yeah, no, you're right. But I just like the fact that a Rothschild man is looking at his wife and is like, you with that Muslim. You know what I'm saying? I just think that the thought of that, I love that shit.
That's right. Let him go to that box face down.
Matt was on vacation. You know what I'm saying? Comes back. Why does his lips look like this? Oh, my grandfather. Yeah, all right,
y'all. Well, listen, thank y'all. This has been All Politics of Local America's number one radio talk show. So we'll see y'all.
Stay in touch, Lyle. Keep doing your thing. Keep blowing it up, man. We see you.
And of course, as my brother Zaid said, we'll catch y'all. Where's Zaid?
Whirlwind.
Catch y'all in the whirlwind. We'll see y'all next week.
Black Power.
Peace.